All right, well, good morning, everybody. We are excited to be back with you for a second day together. It was so inspiring for our team to see you all come together yesterday, to have the breakouts, to hear the dialogue that you have, to see the things that you shared, and for those that had videos, to hear from everybody. I do have a couple slides this morning, but just quickly before we go to those, you all have made so many tremendous changes to move through 2020 with COVID. And the work that you do, the couple slides I'm going to share this morning, my background is a nurse in public health. And so I get to work with lots and lots of local health departments, but lots of community partners as well. And that's where I'm happiest, is out in the community working with folks like all of you in the coalitions. I have some big shoes to try to fill a little bit from Dr. Crespo and all of the work that he's kind of established with all of you, that you couldn't have done it without each other, I don't think. But as we move through 2021 now, one of the most important things I think that I'm learning is the work you are doing now and the work you do more moving forward is never going to be more important than it is now coming out of COVID. We learned a lot last year, but we have a lot left to learn in terms of the impact that it had on us and our communities. So there's just nothing going to be more important than the work. Your work will never be more important as in the next 10 years, 5 to 10 years as we recover. And here in West Virginia, they tell us it's going to take at least the next 10 years, health-wise and economy-wise, to really recover. So I just wanted to share with you some new data that was just released last week to give you a little bit of context of the things that I'm watching and seeing that I thought might be helpful for you as well. So Kevin, I've just got 3 slides, if we can go to those. So as you all know, each year across the nation for every state, we have national vital statistics reports that come out. And those annually tell us the primary causes of death in our country. They do that overall, and they do that by state, and it comes out of the National Center for Health Statistics. Generally, it comes out in November of each year for the year prior. So it takes that long to really put that data together and to formally and publicly release it. But there was such an importance to needing to understand what we saw in 2020 that they did kind of a provisional release last week for January through June of 2020 in terms of a rapid release of mortality data so that we could begin to understand the impact of COVID. And this especially speaks to the work that you all do, that we all do together on chronic disease. So keep in mind that whereas they said that for that first 6 months, we saw a 17.7 increase in mortality. You know that many of those deaths were increased due directly to COVID. And so when we see this data, this is that primary diagnosis that they're identifying as the cause of death on death certificates. And so that's where that comes from, is what each state sends up to the national level, and they put that together. So we'll go ahead and move to the next slide, and keep in mind that the statistics we're going to just walk through for a minute here before Pat speaks to us from the Centers for Disease Control for a few minutes does not take into account the big surges that we saw. So this takes into account what we saw in March, April, May, but it doesn't count what we saw in July, August, September, and then the greater surge that we saw in really November, December, January. So trends and leading causes of death comparing 2019 and 2020. So in 2020, deaths due to heart disease increased by 4.8%, and that's pretty significant. Deaths due to unintentional injury, and some of you shared yesterday the work that in addition to doing around chronic disease, you're also involved in opioid or substance use. So when we talk about unintentional injuries, these are primarily, let's go back 1 slide.
Sorry about that.
That's okay. The unintentional injuries are primarily those that are due to drug overdose. So here we go. And so that actually increased 11.1%. And we kind of knew that. And we saw that quickly in almost every state in May. When the stimulus checks out, we saw some pretty significant spikes. So we knew that we were going to see that in the first 6 months. We saw deaths due to Alzheimer's increased by 9.8%. We all think about and understand that there were changes in access to care. Deaths due to influenza and pneumonia, while we know, that we had a lot of COVID, they were still increased by 7.5% that first 6 months. And that does kind of vary year to year. The greatest change that we saw, or the greatest trend in leading causes of death in the top 10 to 12 to 15 causes, was deaths due to people dying due to diabetes. And it increased by 15.4%. So when we look at the work that you are doing in your diabetes coalitions, and we can go ahead and go to the next slide, which actually just shows you the actual numbers. You can see there for diabetes, it ends up being, usually about our 8th or 9th cause of death. But look at the increase in the raw numbers of people that died due to diabetes, from 87,000 to 101,000 in 2020. So we know that we really got our work cut out for us in the years to come. And there is never a time that's going to be more important for the work that you do around diabetes and chronic disease as we go through a recovery period from COVID. We'll get better with our vaccine. We are seeing variants, but those will be integrated into the boosts that we see. And we will kind of have a new normal for a while. But it's not just about COVID. It's also about diabetes and other chronic diseases, and access to care and healthy living, and really continuing and building that focus of what you all do every day. So any comments or questions about that? Had anybody seen this data? And I went ahead and put the others up so you could see that. COVID ended up being our 3rd leading cause of death, but only for the first 6 months. So that may change. We'll see what that looks like when they get all the data. And there's a lot of emphasis on really getting that next 6 months data pulled together, but it'll be a little while. All right. Is anybody surprised by that? Is that kind of what you're seeing?
No. Well, yeah, one of the things that we need to keep in mind, though, is that heart disease is always number 1.
Yep.
And cancer number 2. But I'm concerned about them as well, because people are not getting their preventive care practices because of COVID. And so those are going to go up as well. And one of the messages that coalitions could get out there is the fact that people need to go and get their preventive care. Go get their screenings as much as they can, put on their mask, get their vaccine, but make their appointments, because we're seeing an increase in those deaths as well.
Absolutely. Yeah. I mean, increased by 5% we saw in the heart disease for sure. 4.9%. We kind of go back and forth between the heart disease and cancer in some states in terms of what's one right now. But we saw an increase in stroke and everything. So.
Yeah, another thing too about heart disease, most people die of a heart attack. I mean, they may have diabetes as an underlying cause, but it's hardly ever listed sometimes on the death certificate.
It is, but where we see it listed as diabetes as the primary cause, I was pretty surprised that it had increased,
Yeah.
50%. It's significant.
Mm-hmm.
All right, Kevin. We can move away from that. And with that, I'm going to move into introducing our morning keynote speaker today. So Pat, I'm going to actually throw it back over to you. Pat's with us from the Centers for Disease Control. Pat's been working, funding and working with the coalitions for many years. Usually we have the opportunity to spend some time with you in person.
Yeah.
But we'll do that virtually this morning. I know you've been a strong supporter in providing guidance and leadership to both Marshall and the coalitions. And I'm pleased to introduce you to speak to the group this morning.
Yes, thank you. And now I'm going to try and share my screen. I hope Kevin is nearby.
Yes, I am.
Oh, you disabled my screen sharing?
Let me fix that. Sorry about that.
Okay, thank you.
It wasn't intentional for you. It was all participants. There we go.
Okay,
You should be good now. Sorry about that.
okay. Um, can you see my screen?
Not yet.
Just no.
Okay. Um,
So after you hit the green button, there should be another window that pops up and shows several screens that you can share, which are just the applications you have running.
okay. So can you see it now?
No,
No. You can?
no.
Not.
Oh, okay. Hold on.
On
Let's
mine, it's
see.
usually the upper left-hand screen if you click on it after the green button.
Okay, I have
Then I
clicked
can open
on
my PowerPoint after that.
the green button and then,
Where it says screen on the upper
yeah.
left.
Select a window that you want to share, and I've already clicked on that.
Yeah, there you go.
There you go.
All right, okay. All right, well, of course, my name is Patricia Thompson-Reed, and I've been working with this project for almost 20 years now. I work in the Division of Diabetes Translation, and actually my first introduction to the project came when I was teaching the Diabetes Today course. I met Dr. Crespo. He was very interested in the Diabetes Today curriculum. But at the time, I didn't really know a lot about the Appalachian Diabetes Control and Translation Project. But he had this vision in his mind way before I even knew about the project. And so he said he wanted to become more familiar with it. And he took the course and modified it so that it would meet the needs of the Appalachian population. And little did I know that I would be involved with the project, because there was a project officer before I got involved, Darylyn Everhart, and she left our division and I was assigned to the project. And the rest is history. I am very much happy that this happened. So now I'm pleased to speak to you today about what I've learned over the work that we've done collectively during this period. But before I do that, I'm going to just share with you some of a little bit about our division, because I think it's important for you to get the background. The vision of our division is a world free of the devastation of diabetes. And our mission is to reduce the preventable burden of diabetes through public health, leadership, partnership, research, programs that translate science into practice. So now I've always talked to the coalitions about developing a vision statement and a mission statement, but this is the vision and mission for our division. Our strategic goals is to, one, prevent diabetes, prevent complication, disabilities, and consequences related to diabetes through improved approaches to care, and to reduce the differences in health that impact people affected by diabetes. I want you to pay attention to this third strategic goal. This is very important as we move forward with this presentation. So what does our division do? What are some of the things that we do? We measure how diabetes and its complications affect the populations in the US. And we do this through our surveillance system. We study interventions. We don't do the bench work. That's usually done at NIH or in other organizations. But the bench research is done by in most cases, NIH. And then it comes to us. And our role then is to study the interventions, find out what works, and what best to do when we try to implement these in our partners. So after that's done, we fund and help guide states in the US. We fund all 50 states and territories. We fund cities, counties, tribes, national organizations, and other partners to use our evidence-based interventions because they have been tested and proven to work. And finally, we share this information with the rest of the United States through our publications. So I'm trying to move this other thing out of the way. I guess it's going to be hard. How do I get rid of this column? My view needs to change.
Well, we don't see your other windows. We just see your PowerPoint. So
I know. Well, that's good. So let me just go ahead and read them. So the program was implemented in 2000 through an interagency agreement between the CDC, the Appalachian Regional Commission, and Marshall University. Well, the IAA was only between the CDC and the ARC, but the strategic partners in the agreement were CDC, Marshall University, ARC, and an advisory committee composed of CDC, the diabetes coordinators in the states, and Marshall University staff. We actually had a meeting before this particular meeting on Tuesday, and we normally have this meeting on the first day of the annual meeting. Well, it's not really annual, it's usually every 18 months. This program was focused on the distressed counties in Appalachia as defined by ARC. Now, again, I think Dr. Crespo talked to you about this yesterday, or he mentioned that yesterday in our meeting. After the coalitions have been selected, they go through a 2-day or 2 or 3-day course where they bring their partners and they are guided through a discussion where they refine their project goals and objectives, and then they receive their grant. So again, this process helps the coalition and their partners to actually sit down and decide what it is that they really want to do and refine those goals and objectives. The purpose of this project was to develop community coalitions as a new and novel approach to reducing the burden of diabetes in Appalachia. And when we talk about reducing the burden, it's not just reducing the burden, but reducing the disparities that we see in Appalachia. In 2010, like the prevalence of diabetes was about 9%. It has gone up since that time. But the prevalence of diabetes in most of the distressed counties in Appalachia were at least 11%. So we were trying to reduce that. The rationale for selecting the distressed counties was also strongly validated by data showing the diabetes belt. Now, this research was done in 2009, but it was published in 2011. And so this helped to strengthen the reason why we selected the distressed counties in Appalachia. The funds were allocated by CDC, were also matched by ARC, but the match also increased over time. Matched by ARC increased over time. Counties were added to the project annual through a competitive process, and I think that Dr. Crespo talked about that yesterday. But each coalition submitted a proposal and we went through that, and we had our own criteria for how they would be selected. And to date, well, there were 75 coalitions in the network, but I heard yesterday that that has changed. And a lot of that changed because of COVID. So we can update that at another time. Now, ARC defines their counties, the Appalachian counties, as distressed, at risk, transitional, competitive entertainment, based on the 3-year averages for the following economic indicators: average employment rate, per capita market income, and the poverty rate. But CDC has focused its effort in Appalachia by placing or selecting coalitions in the areas of greatest need. Therefore, our focus was focused on the distressed and at-risk counties in Appalachia. Now, the diabetes belt is the area in red with a prevalence of diabetes over 9%. But most of the counties in Appalachia had a prevalence of diabetes over 11%. And as you can see from the map, although it's kind of covered in my thing here, the area goes all the way from Pennsylvania down through the Appalachian region and through parts of Georgia, although there are no counties in Georgia right now that are funded, to Alabama and Mississippi. So this is what we have described as the diabetes belt based on our surveillance system. And again, this was published by Barker et al., and it's in the American Journal of Preventive Medicine 2011. So if you want, you could look at that and see and get more information about how this was done. In 2010, there were 240 counties in Appalachia, 232 were in the diabetes belt. Now, people who live in the belt have higher risk profiles for diabetes. They have higher levels of modifiable risk factors, such as obesity and inactivity. When I say modifiable, it means that these things can change. They have lower levels of education, lower levels of access to healthcare and access to nutritious foods. And again, I want to stress the prevalence of diabetes is at least 11% in these counties. Some go up to 13 and 14%. Again, we have this map that was produced by ARC. The red outlining shows the region that we call this is the Appalachian region. The blue or grayish color, that is the diabetes belt. These are the areas where the prevalence of diabetes is high. And you can see from this map that the belt is not just in Appalachia. This particular map was chosen to be displayed this way because we are really basically interested in the Appalachian region. So you can see from this map that the belt includes several other counties that are not in Appalachia. And if we had the map of the United States, you would see that there are other counties in the US that are in the diabetes belt. But for our purposes, we are focused more on the Appalachian region. This map also has in the blue, the coalitions that have been funded, and the green dots are the ones who received advanced funding from other sources. So what have we learned about this work? I use this quote because I feel this is appropriate for the approach that we use in providing technical assistance to the Appalachian region. The quote states, "Give a man a fish and you feed him for a day. Teach a man to fish and you feed him for life." I think this really does describe what we're trying to do in Appalachia. We want to build the capacity of the people to identify their problems, to be able to voice them, and then to develop solutions. I think that's much better than giving people a lot of money and they don't really know what they want to do with it. So, providing technical assistance and resources to organize and support local coalitions to build their capacity to identify, number one, to solve and act on local problems is an important end in itself. You know, first people have to be able to identify the problem, and then they need to talk among themselves, how can we go about solving these problems? And how do they act on it? Do they need new partners? What kinds of resources do they need to act on it? So the three important components of that are really important for community development efforts is participation. Community members and organizations that are interested or have some idea of what the problem is should provide input on problem definitions and also what the solutions can be. The second thing that's needed is leadership. Leadership is so very important. In Appalachian, coalition leadership could be 2 to 3 persons, and they serve as a base for organizing coalition activities. But you'll notice that in more developed coalitions, you have elected officers, and you may have some coalitions who have actually gone on and gotten their 501c3 status. Of course, they really can't get that until they have elected officers. And this is something that the coalitions should begin to think about and to organize themselves in the future. Getting 501c3 status also means that you can get funding from outside sources. And I think this is really an important thing. The final thing for providing technical assistance is giving the coalitions access to valuable resources, such as information, which is very important. The technology that they need, do they have access to Wi-Fi or to Facebook? You know, what is the new technology now and how can we help them to not just access it, but how can we help them to use it? And capital, you know. The other thing we learned is that health related coalitions can serve as an extension of public health to increase awareness, to provide access to valuable resources, and to deliver evidence-based intervention, health promotion messages to the population. Examples of this include one, which is what we started with when the coalitions first began, implementation of the diabetes self-management and support program, raising the awareness of the population to the national DPP. If you're not aware of the program, you're not going to seek the services. So initially we started with just raising awareness of the national DPP, raising awareness of what pre-diabetes is. Most people knew what diabetes was, but lots of people didn't understand, well, what is pre-diabetes? And how come I don't have any symptoms? So raising awareness to the disease was important, but also raising awareness to what the national DPP could do for the population. And then the next thing was implementation of the national DPP. Several coalitions got involved in that. The other thing that was done was increasing participation in community-led physical activity, walking groups, walk with ease. All of these were done early on in the establishment of the coalition, and it also helped to raise awareness to the national DPP and also implementation of the national DPP. Another thing that was done in terms of delivering evidence-based health promotion activities was working with partners to change the built environment to promote wellness activities in communities, such as building walking tracks, local gardens, and implementation of health fairs in places that were accessible to the community. The project also provided opportunities to share experiences with communities and with others locally and in the region to strengthen the work that needed to be done. There is strong cultural pride in Appalachia, and it is very common among the people. And it results from their attachment to the region, and a lot of it is exhibited in local foods, music, and the way people deal with one another. They're very close-knit. The annual meetings, which was every 18 months, increased the opportunity to commute these experiences, to communicate these experiences, to share the challenges with their peers, strategic partners, and others outside of the network. And the last thing that I want to throw out there, and I think this is so very important, collectively, the coalition can influence local government and the private sector to improve local facilities and enable a healthy environment for improving health and wellness. I think this is something that we will see happen in the future. It may not have happened yet collectively in the network, but it certainly is happening within each coalition. Sustainability. This is so very important when you talk about community organization and development. You know, we want to sustain these coalitions, and usually they sustain themselves, whether we're there or not. One thing to keep in mind is that we did not fund the coalitions more than one time. The funds were given to help them to develop their coalitions and to develop their ability to access resources so that they can provide the services that are needed in their community. So coalitions who provided an added value to their communities were sustained over time. Access to other sources of funding, which was provided through the university or through CDC or through other partners, provided opportunities for further growth and increase their ability to secure additional grants from other sources. Sometimes you've heard the saying that the more money you get, the more you get. The more money you have, the more you get. And I think that's true, because once you start to get funding from other sources, it gets easier to get more funds. Now, we talked about name recognition and we discussed it yesterday. It was really interesting because I thought about this, and I think what Deb talked and showed us about the data is something that we should think about. Most people at CDC are aware of the Diabetes Coalition. And so the idea of changing the name is something that you should think about seriously. Over time, many of the coalitions have evolved from a focus on diabetes alone to other health and wellness programs. But I think it's important for them to really think about whether or not they want to change the name of their coalition. And that's up to each coalition as they have a discussion around this issue. But keep in mind that diabetes, no matter what health issue is discussed, diabetes always comes up. You know, if you control your diabetes, you control your TB. If you control your diabetes, you have better outcomes with COVID. You know, we need to think about the linkages between diabetes and other chronic diseases, because there are many. There's a linkage between diabetes and hypertension, diabetes and heart disease. There's so many linkages that can be made between diabetes and other chronic diseases. So think carefully about whether or not you want to change the name of your coalition or the focus of your coalition, because there are many linkages that can be made. Now, another thing about sustainability, changes in federal and state policies can challenge the functioning of the coalition. So coalitions need to be nimble and flexible so that they can be resilient in a changing policy environment. I can give you some examples of this. Participation in the project advisory body went down when the state programs changed the way they organized their staff. Public health has been cut. Funds for public health has been cut over the last 10 years or so. It's been, every year there's a reduction in the amount of money that's been funded. And that goes into not only CDC, but also our state programs. And because of that, there had to be a person that was normally in charge of diabetes was now expected to do diabetes, heart disease, or maybe even cancer. So you had an integration of many of the chronic disease functions at the state level. And the participation in our advisory body went down because we couldn't find out who the person was who was in charge of diabetes, or they had other priorities and could not attend the diabetes, the meetings, the coalition meetings. This also happened at CDC. Changes in CDC priorities resulted in the availability of funds. And so you will find that Congress will fund CDC, but they're mandated to use the funds for certain projects or for a particular area. At CDC, most of our changes occurred because of the availability of the sun. When we first started with the program, we focused on secondary prevention. Over time, the science for primary prevention came to the front, and this became the priority for funding at the CDC in our division. There were changes in ARC priorities. Initially, again, leadership and funding is decided by Congress. And so ARC priorities became the opioid crisis. So over the last 4 years, there were changes at CDC changes in the priorities at CDC and at ARC. At the coalition level, you'll find that partnerships change, membership change, and the leadership may change over time. So this is why it's important for coalitions to be flexible and nimble and stay abreast of what's going on in the policy environment. The last thing I wanted to mention about accountability, sustainability is the fact that coalitions with more than 5 partners are more likely to sustain themselves over time. And again, if priorities change, then you probably need to look, who do you have on your coalition? Who are your partners? Maybe you need to recruit new partners in order to address the changes in the policy environment and the availability of resources to serve the population. So that is something that coalitions should review every year and make a list. Who do we need to get involved with our coalition right now? Who should we recruit to be a part of our leadership? The other thing that I think coalitions should keep in mind is that in this new administration, and because of COVID, there is an awareness of the need for supporting public health at the local level. So I predict that there'll be more resources for building the infrastructure, public health infrastructure over time. I have seen the demise, especially as it relates to local health departments. They have been decimated across the nation. And it's creating a lot of problems now in solving some of the issues related to COVID. And I really would suggest and encourage coalitions to maintain their relationships with local health departments and make sure that they are involved, and to also maintain their relationship with the state health department staff, because I think there'll be lots of changes coming at that level as well. Our strategic partners. I mean, we would not have been able to do this project without Marshall University and the ARC. Marshall is a respected local university and played a major role in the success of this project. The organization or the university had the trust of the people and the coalition members within the network. And that is key to maintaining the network. If you do not have the trust of the coalitions, it's not going to work. If you don't have the trust of the people, it won't work. The other thing that Marshall did, they were like the in-between. They created a space for negotiation on issues related to authority, leadership and authority, from the top down and the bottom up. They had to deal with change with what came down from CDC and what came up from the coalitions. But they created a space for that discussion because you had lots of administrative changes. You know, CDC was saying we need to collect more data. Marshall made a change in the data collection tool. And so then they had to also work with the coalitions to get them used to the use of the new tool. So Marshall University was in the middle of all of this, and you have to have a space for that negotiation. Coalitions want to do what they want to do. And if you're not able to communicate what you would like to do with them, it's not going to work. So regular technical assistant visits to members of the network coalitions were made on a regular basis or as requested. And I remember there were times when I had our monthly calls with Richard and he was on his way to a coalition and he took it in. So I know there was a lot of back and forth and visits being paid to the coalition. And finally, regular communications with the coalitions and with partners, strategic partners, was maintained. And one way this was done, and I think this was excellent, was a monthly newsletter highlighting network news that was prepared and distributed by the Marshall University staff. And I assume that it was received by all members. And what I loved about that communication was that there was a highlight of at least one coalition in each of those newsletters. And I shared it with many people at CDC, and they were like amazed at what these coalitions had achieved.
Pat, we've got about 2 minutes left.
Yes, so ARC is a regional body created to advocate and support the development of Appalachian states. They collaborated with CDC to provide technical assistance to Marshall University and staff. The ARC staff had intimate knowledge and experience of the Appalachian region and its people. They participated in decision-making discussions around all policy and administrative issues, and they provided information about ARC investment opportunities in the region. So our final slide, the Division of Diabetes no longer funds the Appalachian program as we know it now, due to funding priorities and changes in the strategic directions of both ARC and CDC over the past 4 years. ARC changed its funding priorities. And as you know, it was focused on the opioid crisis. And CDC changed its funding priorities, and that was focused on primary prevention. So our division currently funds Marshall University for the implementation of a regional pilot focused on the national DPP. And there are a few coalitions who are involved in that. So my recommendation is that the coalition should monitor the policy environment and look for grant opportunities that are available, and maybe even consider applying for grants as a group. The coalition should also discuss becoming an implementation partner with organizations who apply for grant opportunities. Not all coalitions have the ability to accept grant funds, but they can become an implementation partner. And I think they should start with their state. They should start with their state. They should look at other division and centers at CDC. They should look at nonprofit organizations or other funding agencies as appropriate. And finally, go for the grants that will help your organizations grow and serve the members of your community, and let your action plan be your guide. You shouldn't go for every grant that's out there. What you need to do is use the action plan that you developed and let that be a guide for the kinds of grants that you would go for. And finally, I know I'm running out of time. I want to thank you, and I want to say it's been a pleasure and my privilege to work with the Appalachian Diabetes Control and Translation Project over the last almost 20 years. And I want to give a shout out to Richard Crespo, Sheila Prager for all the work that she has done over this period. Deb, how do you pronounce your last name again?
Easter.
Keister, who has now taken over the helm in the program at Marshall. To Kevin Simpson, who's always been there to help us with IT. And I really appreciate his work. To Regina Knox for all that she does with her grantees and the physical activity that she's always leading whenever we have our meetings and even on Zoom. Catherine Mickens and Mary Rice and all the coalition members and local health department members who have been supportive of the project over the years. And thank you again. And I hope that we stay in touch.
Great. Pat, thank you so very much. It's our privilege to have you with us today. So we were so glad that you had time to join us and to provide this presentation. I am going to keep us moving through the agenda today. You all have a lot to share with each other as well. And I know that there was great discussion in the breakouts yesterday. Pat, if it's okay with you, if folks have questions, if they could put them before we move them into the breakouts, if you could put your questions for Pat in the chat box.
Yeah, please do.
Then we'll make sure that we either try to come back to those or, as we move through the agenda, or we get you connected with folks and make sure folks get answers to their questions. So with that, I am going to move us into our breakout sessions. Similar to yesterday, we have with us today again Kristen DeBoard, who's going to be in our breakout room 1 and focused on our practice makes perfect and our mobile cooking. And welcome back Gina as well. So for our diabetes and oral health, Smiles for Life. And Kevin, we're going to look to you to kind of move us to that next step to our breakouts. And we will go ahead and take the full 45 minutes. And so we'll see you all back in 45 minutes.
Yes, I do want to say one thing. Please, presenters in your breakout rooms, please allow at least 5 minutes for our members to come into the room and get settled. We had a few delays where people had registered and did not select a room. So we'll have a couple stragglers. So please allow 5 extra minutes, please.
All right. We'll see you all back for a scavenger hunt in just a little bit with Regina.
Oh, one last thing before I leave. Eric, did I call out your name? Did I give a shout out to Eric Stockton?
You talked a lot about ARC, but we will come back and give a shout out to Eric when we get back.
How could I forget Eric?
Your credit was implied, Pat.
I don't know. I could have forgotten. Yeah. Okay. So what room am I going to now? Let's see.
You have a preference, Pat?
No, not really. Just put me into whatever one needs another person.
Okay. We'll leave it up to Kevin.
What room did you attend yesterday? I forgot.
The one on the nutrition intervention. Yeah.
Gotcha. Let's see here. I can move you as soon as they get moved over. Let's see here.
Yeah.
There you are. Okay, you just have to accept the join and you'll be good.
Yeah.
And okay, Eric, what room would you like?
I did oral health yesterday, so that sends me to cooking instead.
Okay. And Deb, you wanted to stay here. Jan, where would you like to be? I can't hear you, sweetie. You're
Sorry. I did oral health yesterday, so I'm going with Eric.
Okay.
Yeah, me too.
And Jamie too.
Yeah.
Okay.
Thank you.
Kevin, I will stay here today.
That's right. Okay. I've got one more straggler here, which is Kim. Oh. Kim Stauffer. Hi, Kim, are you with us? I want to just put you in your room. I don't have you selected for a room. I think we added you last minute, which did not give us some time to assign you to a room. Kim, you are welcome to also text that to me in the chat box if you're having trouble unmuting. Okay.
We can make it about work.
Sure. There's a lot we need to share, right?
Kevin, can I start now?
Let's give it one more minute, please. We'll go. I think we've got everybody. There was just one more straggler there, so I wanted to see, but she never responded. So
Well, she's missing out.
I know, especially on this room, right? Okay. Well, you know what? I think you're good. Let's just go ahead.
Okay. So I will briefly introduce myself in case people have not been to a prior diabetes conference. My name is Kristen DeBoard, and I work for Williamson Health and Wellness Center doing marketing and nutrition. For purposes of here, most of our nutrition falls under the farmers market projects. So I do a lot of work with the farmers market. We have a mobile market. We have a community garden. And then recently we have taken on some projects doing meal kits with our people in recovery and people that are food insecure. So our presentation today for Practice Made Perfect is really a project that I was supposed to be doing hands-on pre-COVID, and I was so excited last year to get to go on the road. I wanted to work with those counties that Richard had lined up for us to go in and show them how we do our cooking classes, because we're probably the only people that cook and don't have a kitchen. So I have to do everything on the fly all the time. Well, then COVID changed that, and our budget was able to shift to doing virtual programming that can still be adapted for hands-on. So as things now are slowly starting to open back up, and I've been able to go now for 3 weeks and do hands-on classes again with our drug court. This is the first thing we've done since last March. But we're able to use the same programming. So it's kind of a really neat concept, and I'll just go ahead and get into the PowerPoint this morning. This morning we'll cover the PowerPoint, and then after our break this afternoon, we will cover some of the other things that the resources that you'll need really. So let's get going. All right. So we are going to learn how to fuse Appalachian cuisine with healthy eating trends for a modern approach to virtual. There's just a little background about Williamson Health and Wellness Center, and I won't read all of that to you, but I am upset that we lost our title as the only FQHC in Mingo County. So now we're just the largest FQHC in Mingo County, which is great for our residents. It's just not as braggable for me. We have in-home community healthcare workers that work a lot with our diabetes patients. And then we are kind of the hands and feet of the city. I work in the outreach office. So we have clinic staff here on one side. Then we have our outreach services, which are healthy eating, active living, and community engagement. We do most of anything that pertains to fitness and activity and healthy eating. And then here's a little bit of our programs. So you'll see our community garden, which is Ramella Park. We have 25 raised beds and 3 high tunnels. Actually, this year has been the largest year that people have, all of our beds rented. We did our last one Monday. So I'm a little excited that the garden is coming back to life. And then we also do farmers market, which is our permanent market home. We have an active CSA program. That's me packing CSA bags. Last year we had 55 participants. And then our mobile market is in the bottom left. So our mobile market is the little refrigerated trailer that we pull all around the county to address transportation barriers. And we've been doing a lot of these things since 2012. This is my kind of how we were change agents. So anywhere that lets us cook and any audience that we can target, we want to show people the benefits of healthy eating so we don't have to see them later in the clinic. So if you look through there, I know it's a lot going on, but you'll see seniors, you'll see children, and then our recovery community has become a big part of our job for the last 2.5, 3 years. We've done a lot of work successfully with people in recovery. And I really enjoy that. And then those recipe cards there is part of our new programming for Practice Made Perfect. So I just weaved them into here last week. But we just want everybody to eat good and feel better. So Practice Made Perfect is our series of videos that you can teach through virtual. You can give them access to the website and they can watch videos on their own, or you can teach a hands-on class and use the same curriculum. And I will walk you through that. And I just want you all to notice in that frying pan right there, those are the Appalachian Mountains. We worked really hard on that logo so it would represent everybody that I thought we would be working with. And that's not gravy behind the frying pan. It's supposed to just be like a mixture of flour and salt. We had a good graphic designer. So here's the gist of the program. Nobody is a chef without training, but training is simply practice. So I think there's a misconception here. A lot of Appalachia struggles with grandma is the cook and we only eat when we go to grandma's house because mom doesn't have time. Or a lot of our younger people are seeing different trends too, I think, with parents. And then your recovery population is also struggling to cook because many of them have become users at such a young age that is something that they never did. And you're not really concerned with it when you're an active user. So we're seeing people that have just never been taught to cook or never bothered with learning. So the curriculum is made really for everybody. It's very short, very simple, concise lessons. And you guys will see all that this afternoon. All the recipes are mainly produce focused. There's a few that probably don't have as much veg as I would like, but the majority of them feature at least 3 servings of veg or fruit in each recipe. When you're teaching curriculum, you want to make sure that you put yourself into this. So we went into this thinking that I'm going to make this professional and I'm going to represent Williamson Health and Wellness. And after we went back and watched the first recording, like everything was so dry, and we realized that we can look professional without having to come off as it being school, because you want people to enjoy themselves and have fun. So what we did was all those little things that we thought of as we were going, we called them mountain morsels, and we worked little things into the video that reflect ourselves and our cooking style. My coworker, Rebecca, she is gone to pick up garden tools for me today, so she could not be here, but she is all throughout the videos with me, and we have completely different cooking styles. And you'll notice this when you do start to work with people. Everybody cooks different, and that's what makes it great. So just make sure that as you teach it, you can teach off that curriculum, but be yourself. It doesn't have to sound like I'm the one that's teaching. All the recipes that we used were traditional Appalachian recipes that we tried to make a little bit healthier, or we did something completely off the map that we thought nobody had ever tried. So there are a lot of things in here, like you'll see skinny biscuits and gravy and things that we've tried to go back in, and we know that people will attempt it. And then you'll see stuff like white beans and quinoa with Brussels sprouts and cranberries that we thought most people would not be familiar with. We've been doing these right now as meal kits. So what we do is actually take them to our clinic staff. We're working with people in our medically assisted treatment facility right now. So we take them on Tuesdays, and when people come in for their group therapy on Tuesday and Thursday, their kit is there in a cooler and they get it as they leave. So it's eliminated the burden for us of having to do deliveries or schedule pickups. We're able to coordinate right now with the clinic. All of that can be changed, but those are just little things you can keep in mind as you're working on this. If you're trying to write a grant, or if you have existing funds, try to make it convenient for yourself. Meal kits seem to be the way for us to go right now. And then keep yourself with a set price point for all meals. And we focus on local. So if you live somewhere where there's a farmer's market, definitely want to encourage you to utilize your farmer's market so you can get fresher food. You can usually get discounted prices from farmers. Most of them are very frugal, and most of them, when they find out that you're doing something to get food to people that they're not paying for, will give you a better price than what you might pay at the store. Now, for your target audience. So we really did develop this, that it could be done for anyone, because we do work with so many different people. So children ages 5 through 12, we do junior chef. So you could use this for that. Junior master chef, we've been working on with the older kids. We did our first 2 right before COVID, so I haven't done those since, but this could be adapted for that age. Your adults that are in recovery, seniors with health concerns are really easy to work with, because most of them, we really like being able to teach preventative care here. And I don't know if that is everywhere, but here it seems like we can talk and talk and talk about preventative care, and it doesn't become real to people until they are actually dealing with a diagnosis or a new medication. So when we go into the senior centers, most of our seniors are eager to work with you because they have identified a problem and they're now on medication, and they're like, how do I fix this? Oh, I didn't mean to do that. But anyway, most of them will be a lot more able, or not more willing, I would say, to work with. So the curriculum for them is great also. And then on the bottom of that slide, because I don't want to go back, it said anybody with ears, let them hear. So our target audience is normally anybody that will listen. And the way that we go about reaching them, partnerships, that maintain your partnerships and your connections, because it is very vital for your community. We have great partnerships with all of the people that I listed here. Our senior centers haven't reopened yet, and not all of our seniors are Zoom familiar, so I've hesitated on that. But we just started using this virtual curriculum. 1, 2, 3, 4, 5. We're on our 5th week of doing this with our patients that are in the MAC clinic, and we are doing it with a sober living home right now. And then once we roll out, they're our pilot right now, testing it to see what we would like to change. But eventually this will go on out to all of the places listed. So if you're doing hands-on, that's great. You can still print all these. They're scripted and typed up in a Google Drive. And if you're going to do the virtual, that is great too. I would suggest going with places where you don't have to pay a fee, like your church kitchens. And it's great because you usually get a built-in audience. So one story that comes to mind about that particular point is we had a church that does the Daniel fast every year at the beginning of the year. And they actually called and said, can you come and do something, because our people don't know how to cook for Daniel fast. They don't know how to eat that way. And everybody, a lot of people will have that misconception that it's boring if you have to eliminate this, and this. So we were able to go and show them how to do pasta. And we made fresh pesto with them, showed them how to do like a cheese sauce, a mock cheese sauce from cashews. So you can tailor these to the audience that you're going to and still make it about your mission to teach fresh whole foods. Definitely work with your recovery population. I noticed a lot of our funding for agriculture on my side is swinging toward helping people recover through food and gardening. So a lot of our new work for this year, we're gardening right now. The rest of our staff is at the community garden doing some things, and we're doing salad beds so they can eat from these salad beds all summer. We want to work with them because those are our future people, and we don't want them to be unhealthy as they are trying to regain control of their life. Your low-income housing projects usually have a community building in the bottom of the facility if it's a multi-story building, or somewhere within the facility if it's a spread out complex. We have been fortunate enough to have one that has a family resource center that was recently designated as an Envision Center. And their mission is to promote family, and they're looking for things that are family oriented. So we have been working with them, and we're going to start doing this with them too, sometime in the middle of the summer. Employer wellness programs work well too. We actually worked with Housing Authority employees and did 6-week series of heart healthy meals. So you can tailor this to whatever recipe you work. If it's strictly diabetes, then you can make all of these low carb diabetic meals. Most of them, because most of them are produce focused anyway. So I think that's the good thing, and that you can customize the recipes. If you don't like mine, make your own. You still can use the basic core curriculum. Diabetes fairs are great places to do cooking demos. So you can't have a full-on class, but you could sure take your laptop or an iPad and pull up a 2-minute video, and while somebody's waiting on their blood pressure to be took or their rapid A1C to come back, you can show them a 2-minute clip of, hey, here's a good way to make a healthy meal. And basically anywhere. So anybody that offers or asks for us to come is where we will go. Recruitment strategies. For me, advertising is a big deal, but that's because I do handle most of the marketing for all of our programs here. I work with our dental clinic to do ads. We do all of the outreach office. For you, I would suggest Canva plus Microsoft Publisher plus Facebook equals success for here. I noticed that a lot of our younger generation is Instagram and Snapchat only. They think Facebook is where the old people are now. So we also have a Instagram that I will pull up and show you this afternoon when we look at some of our marketing employees. But for purposes of recruiting people that are in their middle to upper age, you have to have flyers that say why people would want to come. So if you're using a standard program like Microsoft Word, where there aren't a lot of graphics or a lot of color, then you're not going to get the same response as you would if you're advertising through your social media platform. So some of those, actually all of these are flyers or event covers that we have made for a Facebook event. Most of our population that comes to classes that we're doing for the public come from Facebook. We have a large following on our farmers market Facebook page. So seeing things that show bright and pretty colors, that peaches down at the bottom on the bottom left, that particular advertisement, we had the largest turnout for any class that we had ever had. We had like 27 people show up that night. And I'm pretty sure it was because of the graphic. And then you can tailor those to what you're doing. So if you're doing heart healthy, you do want it to look a little more professional, but it still has to be something that's eye-catching. And if you're trying to do things with kids, remember that your graphic doesn't need to be for the kids. It needs to be geared toward the mothers, because that is normally who is signing up and bringing the kids. We do have some dads here that are actively involved, but most of the time you're looking at moms age 18 to 40 that are doing all of the running with kids. So we try to make those things that we think will catch the eye of who I'm aiming it towards. But you have to advertise. You're not going to have a class if you don't advertise. And we will get into your delivery method. There are 15 total videos for distribution. Those can be accessed through, we've tried to make it the most accessible program that is user-friendly. So we have those on our own YouTube channel that we will look at this afternoon. We have them on a Google Drive with a public link that I have distributed yesterday to Regina and Sheila, so we can get that out to anybody that wants it. It's also going to be housed on our healthyinthehills.com channel just as soon as our IT guy is recovered from his second COVID vaccine, because he had some issues. So he is running just a little behind, but they will be available on our webpage also. And then I'm going to try to get those out on flash drives. So as we start doing Train the Trainers, Sheila has got a flyer, and I think we're getting ready to start advertising Train the Trainer sessions for that. So just as soon as we start doing those and getting people enrolled, I will have flash drives for everybody too. That way you can take it on the road if you don't have internet access. These can also be done by Zoom. So just like we're screen sharing now, if you can't go into a class and do hands-on, but you can still convene with people at home, then you can screen share your screen and play the videos right from your computer. So it has made, it's made everything pretty easy to do it that way. And then keep in mind, if you are going back to doing hands-on classes with an in-person audience, you can still pull up the computer and play the video before you cook. So it's like they get a pre-work demo, so they know what to expect and what steps they're going to go through. And we did one like that last week too with our drug court, and it was pretty good to do it that way. So I've seen kind of both sides of it now. It will work. These are just some suggestions for either way. So if you're doing virtual, you can do meal kits where you pre-package and pre-measure the ingredients for prep at home. And that is what we do on certain things. And on some things, I am not prepping. So we want to teach people culinary skills at the same time that we teach them the nutrition. Then I don't want to cut carrots and celery and potatoes and things for them. We want them to do the work. So things like that, I don't do. I don't give shredded cheese. If a recipe calls for cheese, we've been ordering them blocks of cheese, and we gave everybody a box shredder. They get to see the cost saving benefits of shredding your own and how much you really don't need. You can do a lot with a little block of cheese. And I think people don't think about that because they're so used to buying in a bag. So we're trying to teach people budget minded, and prep friendly things at the same time. But I do prepackaged spices just because it's easier for me to buy it in bulk. Those kind of things you just kind of have to work out on your own. For us, we did patients scheduled on a particular day of the week so they can pick up their kits at the clinic. And then having a designated day. So the ones that we do for the public, when we're trying to do these as the moneymaker, because we also do these and we sell them on behalf of the market. Those we have pickup days. So it's not, you still have to, I guess you still have to make your time make sense. So if you're going to do them that way.
What's up?
Hello? If you're going to do them as ones that you're going to have people pick up from you, then you would have a pickup designated time and place. So say like for us, we'll do farmers markets on Wednesdays from 8 to 12. Just do what works for your area or for your coalition. And then we do deliver. It's probably because we spoil our people just a little bit, but we have a lot of people here that do lack transportation or don't have anybody that can bring them. So on those, there are certain cases when we will make deliveries. And then if you're doing in-person and hands-on classes, we would usually have all of our tables set up. So if we're having groups and I have, say, 4 tables and it's a group of 2 or 3 people at each table, then I will go ahead and split all of the main ingredients and have them on the table ready to go. And then things that we share, say like spices or milk, things like that, then I will put on a general table up front for people to come and use as they please. Leader purchases all ingredients. You can also do it that way. We have some groups that I'm not paying the budget for. Like we'll go in and work with our sober living home, and they have certain money that they allot each week for group therapy. They'll buy the food and they'll have it ready when I get there. So you do whatever makes sense for you and what makes your life easy. So these are our links. And I threw the link on here to Facebook Live so you guys can go back and look at all this later. I won't go into that now, but it kind of just demonstrated how we started doing live feeds last March, when everything shut down and we weren't allowed to go anywhere. We still had to come up with a way to get people involved, and there was a lot of demand at that time for healthy food and produce. People didn't want to go to the store. The stores were running out of food because of the panic. So we started doing something called Pull Up for Produce, where we were pre-packing $20 bags of produce. So if whatever we could get that was semi-local or state grown from Turnrow. Turnrow is an Appalachian farm collective that comes from up north. And they get food from all over the state and they truck it around to Huntington, Charleston, and they threw us on their route. So we were fortunate enough to be able to get food from them. And sometimes it would be a salad kit, and sometimes it would just be whatever we could get. But we tried to put recipes with what was there. And we ended up selling like 150 bags a week, and it was contactless delivery. People would prepay online through PayPal and just pull up to the market, give me their name, and we would put it in the trunk. That will probably never happen again, but it was a great experience for us to ride out, and it made enough money to pay for us to have a market manager this summer. So I don't have to fund the position from somebody else's funding. We were just able to raise the money. So if you want to go on there and look, we were doing cooking demos every Monday with what was going to be in the bag. Some of them are really funny, but because like I said, we cook very differently. So we would bicker online and forget that we were online and go back and forth. But it's a good way for you to see how good it is to be yourself when you're doing these, and to not try to be as professional as sometimes as what you think you need to be. You can still be that, but we don't want to be dry, because we found on the days that me and Rebecca were going back and forth with each other about how we cooked at home, or I would get mad and just let her do it. And it ended up being really funny, because those were the days we had interaction. So we would see, sometimes you'd have 50 views, but on a day that we were really going back and forth, we had one video, it had like 480 views within 5 minutes. So it's just exciting for us to be able to get the word out. We're not doing it for the views. We're doing it obviously to make an impact and show somebody a different recipe. But if you guys ever get bored, that is our Facebook page, Williamson Farmers Market. And if you go back to those videos, you will probably be very entertained from last March through May. That's the link to the Google Drive that Regina and Sheila have, that we will distribute later too as you need it. And that is our YouTube link. So all of those ways you'll be able to get the curriculum. And you also want to make sure, Kevin, how do I go back? No.
Should be able to hit your left arrow on your keyboard.
Oh, okay. Reinforcing behaviors. We also want to make sure that we are getting the message across that we're not just trying to teach people how to cook, and that we're giving you a healthy recipe. We want to back it up with somebody else's scientific proof, just so people have a little bit of knowledge. And a lot of people don't have basic knowledge of how to eat. We might think they do going into this, but they don't. So what we did was we interjected different My Plates throughout the series. I'm doing a 24-week hit right now. So it's a pretty long series for me. So every 4 weeks, I am doing My Plate instructional materials in our meal kits, so people can read that at home. We have been fortunate enough to set aside some budget to do small items too. And you can get some My Plate paper placemats fairly cheap, like for pennies really, if you're ordering in bulk. So things like that, you can order from them. They also have a new app, and now the My Plate is personalized for everybody. Based on different health needs, they give you a series of questions to answer, and it will actually go in and personalize your plate now if you do it through the app. So it's been, I like using their curriculum too. So you can use those, and it's free unless you're purchasing different items, but all their printable curriculum is free. So when we go to hands-on classes, a lot of people ask, what's in a kitchen kit? This is how we built our kitchen kits with some generous grant funding. $169 is the price of a really good induction burner. And I say that we use induction burners instead of like a camp stove, or instead of a one burner type deal that you could buy that you would see in a college dorm room, because you have a lot better safety measures with your induction burner. So if you're cooking with kids or with seniors and they accidentally touch the burner or they hit it with their hand, they're not going to get burnt. The only thing that it reacts to is the metal that you put on it. So unless they stick their hand in the bottom of the skillet and press it there, they're not going to feel any heat anywhere. And they're actually have been really good as far as safety wise with us. The negative side to that is they do pull a ton of amps. So if you're in a building that does not have newer electricity, which are most of the places that we go to, you can only hook up about 4 to 6 of these in one location. I have 10, and we have pop breakers everywhere all over town. trying to cook with multiple people. So now we just decide we do small groups only, and we take 3 because it seems to be the magic number. Flexible cutting boards are super cheap. And when they get used so much that you feel like you can't clean them good enough or that they look bad, you can just toss them and buy new ones. I use them a lot just because it's easy. Everybody will need, for each set that you're going to have, and I recommend you have at least 2 to 3 sets, you'll need your can opener, your spatula, your tongs, your basic cooking things. And those are very cheap if you order them in quantities of 12 or more on Webstaurant.com. So we use Webstaurant, which is just like restaurant, but web at the beginning instead of the RE. They have all kinds of packaging equipment as far as bags. If you're doing fresh produce and you need bags to put greens in, we order bags from them. We order all of this, all of the kitchen equipment here came from them. They even sell food. So they're like a full restaurant supply store. That's a web-based store without a brick and mortar. So they have really good prices. To do a whole kit from burner, and I didn't put my skillet on here, and it was included in that final number. I just forgot it on the slide. But to do the whole kit, we were looking right over $200. So depending on prices are a little bit up and down right now on certain things, but you would be able to make a nice kitchen kit for $200 to take on the road. So keep that in mind as you're doing your budget for equipment, that you want to allot yourself enough budget to be able to give everybody all the tools that they need. And I also would suggest a box grater. I do have 2 or 3 of them that we've just picked up at Walmart because they're $1, $2. They're not expensive. You will need one of those to show people the benefits of doing it themselves. Fundraising. In my spare time, what little bit we have, I sit around and Google odd things like grants for nutrition. How can I get things paid for? And all kinds of goofy stuff probably, but you get some really good answers when you do that. Some of those grants, like the Cliff Bar Family Foundation, those are small foundational grants that we've applied for. I've been denied twice, but I think this was my year and I won't know till October. But I would encourage you to go look at the Cliff Bar. They're small foundation grants, but you can do a lot with $5,000. If you can buy 3 sets of cookware and spend the rest of it on food, then you can make a really good, effective change for at least 15 to 20 families. NoKidHungry.org. They're doing a lot of projects right now. They had a big push during COVID to get people to apply so they could get produce out to kids. Look at their website. Beginning Farmers is a good one. Emerald hasn't done anything for 2020. I didn't see any winners that were announced. So I don't know if they were taking a break during COVID, but they do grants to push nutrition ed to people. We work through several USDA grants, obviously for the farmers market side, but being in a clinic is a blessing to me because we have opportunities to do things through the 501 and because of being a federal health clinic that we might not otherwise see. So a lot of those grants that we are running off of right now, like Palatine Foundation, of Huntington, they're sponsoring these meal kits for our people in recovery. They're also funding a hiking project that we're doing to get people moving. So we're taking people out and doing guided group hikes. They're funding a lot of projects right now that will be pertinent to the areas where we live. I won't give a shout out to everybody, but I might to Marshall University's Division of Community Health. So, through some funding and partnerships with Sheila, we were able to develop this curriculum. Foundation grants, of course, your ARC grants. Grow App is a garden grant that people can apply for that live in this region. I'm not sure if that extends down to our Alabama and that area. I'm not 100%, but look them up. Paul Mitchell is one of the large funders for Grow Appalachia, and he donates millions of dollars to put gardens in rural communities. They will fund food projects too, anything that you can connect to. If you're working with food, you can connect it through the ag side or the nutrition side. So take advantage of those opportunities for sure. And then develop a plan to work for your program being sustainable. So a lot of times we'll have these opportunities that come through to do things and they're grant funded and we're like, oh yes, this was great. And then it's over. And when it's over, it's just over. We are trying to not do that anymore. So we've been selling those meal kits since we started the pull up for produce kits last March. We did them through May. Then when we went through farmers market season, I didn't do them, but we picked back up in September and did a 6-week series. And then we did them up through Thanksgiving for another 6 weeks. And then we did like a special take and bake dinner at Christmas. And we did a Thanksgiving dessert, just little things that we could do to sell to make money so that we could keep doing meal kits in the future and getting healthy foods out to people. That's what we, to increase access to healthy food. And then also use your extension agents. Your extension agents from your local university are valuable resources, and they often have budget that we don't, or they will have promotional items that tie into what we're doing. Last week, we did a health fair for our employees here, and we did a cooking demo. Our SNAP Ed agent came by and did Rethink Your Drink and gave everybody, a 20-ounce water bottle and handed out fruit flavored waters all day long. So they have often resources that we just, it's not stuff that we can't get. It's just things that they've already got allotted to them that we would have to write for. So if they have the money and need an audience, use them. They have good curriculum. And then make sure you partner with your local farmers and community gardens. So we definitely want to push local. I will always push local just because of the nutritious benefit that you get from fresh food and because it puts money back into your community and it helps your people. So definitely try to use local. Oh, incentives. We have to sometimes give people a reason to cook. Sometimes those are little things like we make them Facebook famous by putting their picture online when they've done a good job. And that really works for the younger crowd. But for people that we want to keep them coming back, we do offer small kitchen tools in these kits. So we have been giving people something every week with their meal, whether it be the measuring cups. We did measuring spoons last week. I did a vegetable peeler 2 weeks ago. Just something little that all those things will add up to them being able to be successful when your programming is over. But it is still incentive money that you can set aside and know that later on you're going to be able to do something with that. And then the bonus items were something that we toyed around with when we started doing the pull up for produce. A lot of people, we have a high percentage of people here that rely on SNAP benefits for their food. Well, with SNAP benefits at a farmer's market, if you're a participating market, you can double your SNAP. So if they spend $20, they get $20 worth of free produce. If they bring a child, then that child also gets a match of free produce. So we've been tripling food since last year. But I noticed that people would not buy things that they consider, I don't want to say, things they consider healthy, are very expensive. So say you're teaching somebody that is diabetic that maple syrup is more friendly for your body. It's a God-made versus man-made. It's just tree water. Your body can process it. It's a different on the glycemic index than Mrs. Butterworth. People won't buy it because they go to the store to look for it. We'll have it at a cooking class and they're like, oh man, this is great. I've never had real maple syrup. And then they'll go to buy it and they'll come back and say, well, it was $10 for a pint. I can't afford that when I can get table syrup for $1.99. So what we started doing was we would have weeks where we weren't trying to make money, where we would just try to distribute things that we thought people needed. So we would do West Virginia maple syrup. That was one of our big bonus items. And these were when we were trying to use these as paid meal kits. You take $8.50 or $9 because that would be a discounted wholesale rate, and then try to make a big bag of produce to go along with that. There were a few weeks where we really didn't make money at all, but I knew that we were getting food in the hands of people that needed it and that it was something that would be a treat because people won't go out and buy those things for themselves. So anything you can find that is West Virginia made, like apple butter. We did apple butter one week. I mean, it's $6 a pint now. So that's a luxury for some people that they will not pay for that. But it was neat because we got to see people that were tasting like real food that they didn't even know was made in West Virginia. So those things, just keep in mind you can do that. Like take a week of your budget when you know you have a recipe that you can do really cheap and throw something really good in there. And these are just some of my general learn from my mistake tips. Read over all your material and see how it will work for your audience. So just because we have 15 videos does not mean that you need to do 15 weeks worth of class. Most places that you go are good for about 6 weeks, or some places 4, and then you'll see attendance start falling off. If you're doing these through online distribution and you can track how people will be on there, that's great. If you're not, then it may just not work the way that you want it to, but you can tailor it to your needs. You can combine classes. You can say, well, I think everybody here knows how to hold a knife, and not do certain classes, however you want to do it. Make sure that you are being yourself. So throw in things so people know that you actually cook, because they don't want to think that you're sitting there telling them how to do something that you don't know how to do, that you're just an instructor. You want them to know that you practice what you preach and that you believe it. So throw in little tips of things that you do in the kitchen that let them see who you are. And pick things that you know that people might not like and show them a different way to cook them. Nobody in this building where I work of people that are educated knew what tahini was. There was 2 people here that had ate it, and I was one of them. So there are just little things that people need to be exposed to, and I would encourage you to do that.
Jeannie, you'll have to let us know when you think everybody's back.
We've transitioned.
Welcome back, everybody.
Can we start finding the stuff now?
Not yet.
Not yet.
All right,
I'm gonna,
Carrie.
You can plan your strategy, I suppose,
plan
since
without
Regina
that.
put it up early.
Okay.
Maybe you better take it back down, Regina. So everybody
well,
can
good
start at the
morning,
same time.
everybody. Since we, you want me to start now?
Yeah, so while we're all back, it's time to move around again, and I'm gonna toss things over to Regina, and she's gonna take us on a virtual scavenger hunt.
Yes, so you'll have 5 minutes to find these 7 items, and the rules are, if you're on like a mobile device, you can't take the device with you, so you can't take your phone or your tablet with you. The item cannot be used for 2 different answers, and you only have 5 minutes, and I have a timer here. I will start right now, so go. Oops, my timer didn't start. Okay, let's start.
Good, that's all the direction, huh?
Yep.
Oh, yes.
Did my time stop? Oh, keep going. I guess I have to keep it. You got 3 minutes and 44 seconds. I got several people that said they're done. Stacy's done, Sharon's done. So just hold on to your items to the clock runs out, so we can get everybody,
Okay.
give everybody a chance to gather their items.
Does it have to be an Amazon box?
What you got instead of an Amazon box?
I have a 4imprint box. I have a FedEx box. I have a Communicorp box. I have a Dell box. Yep. But not Amazon. Let me keep looking. I have two
Now that
2
one-
minutes and 40
that one-
seconds.
That one might be tricky if you're at the office.
Yeah, I'm in the office, but I'm not giving up.
Does Prime, is a Prime box, does that count? Isn't that Amazon?
Yes.
Okay.
Okay, do we need to show you these things?
Yes, we're gonna give everybody an opportunity to let the
got
clock run
FedEx.
down. So,
Well, my box is too
Yeah.
heavy. I can't lift it up. It has water in it.
okay. So just, so once you gather all your items, just keep them on standby.
I'm so aggravated with my husband right now. I'm gonna shoot him. You know, I get Amazon boxes every week. And I just went out to the garage and he's done burned them all. I came back in the house and I just asked him, I said, what happened to all the boxes? I said, you burned them. And he said, well, you're not ordering enough stuff, obviously. So I don't have that Amazon box. I have a box that came in an Amazon box. Does that count? Probably not.
I think you and they have the same problem with the Amazon box.
Ugh. It's my husband's fault. Daggone it.
You got 52 seconds.
Oh, I got one more thing.
I still see people walking around. So once you get your items, just keep your items on standby. I'm just gonna let the clock run down, give everybody an opportunity to find their items. Yeah, 14 seconds.
I have them all now.
Okay, cool, Charlene.
Darling, did you get an Amazon? Do you have an Amazon box?
I have Amazon in my boss's
All
office.
right.
Oh,
So our
I had a hard time
timer is
finding.
up.
I'm so done. I have-
So if you're one of our folks and you're participating and you don't have your camera on, I'm gonna need you to turn your camera on. Because I want everybody who has a piece of jewelry, hold your
Hey,
jewelry
turn
up
the
to your
camera on.
camera. So if you have a
Mine
piece of
is right
jewelry,
there.
hold your jewelry up to the camera. Okay, we got Eric got a ring, we got rings. Kristen, we got Charlie has a bracelet. We got rings. Sue has a bracelet. Cool. Stacy has a bracelet. Okay. Janice, I can't see what you got.
I even got a necklace.
Okay, bracelet. Sheila has a necklace. Cool. Okay, Sharon has a watch. Okay, the next item is a COVID-19 essential. So hold your COVID-19 essential up to your camera.
Oh my.
We got
I
masks.
got a
Everybody got a mask.
Got my wipes.
We got a whole box of masks. We got wipes, mask, sanitizer. Stacey has sanitizer.
Yep.
Sanitizer. Who else we got? Lynn, did you have something? Mary Lynn has a whole thing of Clorox wipes.
Yep.
Catherine, what did y'all have?
Have gloves.
Gloves,
My
sanitizer.
wipes. Can you see my wipes?
Yes, I can pack your Clorox wipes. Cool. Faye has sanitizer. Shannon, what did you have?
I have masks, wipes, hand sanitizer, gloves, plastic gloves, whole bag.
Everything. Okay, so the next one was your favorite coffee mug or tea
I'm
mug,
gonna
your
say it's
favorite
not,
mug.
that's not my
There
favorite.
goes my mug.
Mine
Mug,
is
okay.
3-in-1.
Okay, should we got
Yeah, that's
three?
a
Is that
favorite
three?
here.
3-in-1? 3-in-1?
3-in-1.
Right, okay,
Yeah.
cool.
Yeah.
My
I
mug.
see. Everybody has a mug up. All right. Okay, so the next one is a pencil.
Got
Bring my
that.
pencil.
Wait,
Yeah.
I didn't have a pencil.
pencil with the
Oh, y'all got
rubber on the
pencils?
end.
Gotta show. Pencils. Okay, cool. We got our pencils held up. Great.
Yep.
Thanks, Beth. Beth
This
has
one's cute.
a mechanical pencil. And then the next one is something red. Something red. Okay, we got pillows, keychains, a folder, lip gloss, a bowl, flowers, folders, a flag.
Fresh too.
What else we got?
Had a little girl give me that.
What is that? Free? What is that, Catherine?
I don't really like it.
This is
a tobacco-free container.
Oh,
Tobacco-free container. And Jan, what you got?
that
You-
Tupperware
you're
is
muted.
something there.
Janet has a plate, Tupperware. Stacy, did you have something red?
Oh, something red? My
Yeah.
jacket. My jacket.
Got it, a folder,
A bow.
folder, got it.
Bow.
And then,
Landis has an apple.
and then next thing, scissors, they have scissors. Then the next thing was something edible.
Yeah, I got a coin.
Banana, orange juice, tomatoes.
Jelly beans.
One corn chip, I got you. Jelly beans, Jif peanut butter, skinny popcorn. What is that, Janice?
Oh.
Oh, Oreo cookies, okay.
That sounds
We got
good.
Nutri-Grain bars, peanuts, Sharon has peanuts. Hey, what is that?
These are mixed nuts.
Is it nuts?
Yeah.
Mixed nuts, very healthy. Eric, did you have something edible?
Microwave, jelly beans.
He's eating his edible.
Apple that you've been eating.
My apple from the farmer's market.
Kristen has some chock full of cranberry.
Yesterday, it was 200. Later, I took it, done eating everything at 180. And I'm thinking, how did that
Okay,
get
Sue
that?
has a banana. Okay, and then the very last one, which is a tough one, if you're not at home, Amazon box. And I know Pat's has one is too heavy to lift up, so an Amazon box.
Mm,
That was the, okay, Amazon or Prime box. Okay. And Amazon stock is $3,000 per share.
really?
I want some.
I think I'm
All
part of
of-
my Amazon.
Yes,
Wow.
Yeah, we had them
all
all.
right. So by a show of hands, raise your hand if you were able to get all the items. If you got seven items. Okay, a lot of people. 7 items, how about 6 items? And a lot of people, that last one, the Amazon box, got them. 7,
All
I
of us.
have the Amazon
our
box.
houses are our own.
6.
okay, how about 5, if you're able to get 5 things on the list? 5 things. 5 things. Okay, Beth, I see a thumb. Cool. Okay, well, that is the end of our virtual scavenger hunt. Now, I thank you for participating and getting up and running around the house trying to find things.
Yeah.
That was fun.
I have to go upstairs to get the corn chips. Oh my goodness.
And then when we come back, we'll do some gentle yoga with Sheila and do some piano presence. So we will go back into our breakout.
I could barely hear Kelly. I mean, Debbie. I don't, Deb K. So is it me or is it?
I couldn't hear very well either. I was
Yeah, it was
getting ready to
it was
chime in.
low.
Okay. Thank you.
Now we can't hear her at all. I know her mouth is moving. Well,
Yeah, no volume here from her.
Hey, Deb, why don't you give it a shot again? See what you get.
is she on mute?
No.
No.
Did her speaker come unplugged? If she's using external?
No.
There's a mute button under F5.
She put in the chat box that she wanted everybody to go back to the breakout sessions, and then we'll come back for gentle yoga with Sheila.
Perfect. Okay. Well, I'll send everybody there. And just a reminder that once we're going into these rooms, you will receive a message to ask to join.
And we have to click on join.
Yes.
You can,
Christy, this is Sharon Haynes in Alabama. A quick question I had, the foundation grant that you indicated, is it by geographic location? Or do you know if they expand? I know some foundations only cover certain geography in the state or, county area.
and some of the ones that we work with are like that, but like the Cliff Bar grant is anywhere, and it is a foundation grant. So they get really good apps, and that's how we get ideas sometimes too of what we're going to do. Is I will look at previous winners from all these different grant apps and kind of see what they've wrote and how we could do it and make it new, but know that we're kind of in the same line of what they're looking for. And State Farm, I forgot to list on there too. State Farm does some really awesome grants, community-based grants that will do large funding, and we've applied for some of those too. The only problem with those is you have to have a lot of people that are motivated and excited to vote. They will do like a running process, and they will select so many people to run, and then you have to have community votes for the second phase of that. And we just don't have enough people here that really, I don't want to say we don't have enough people that care, but like we have a handful of people that care, and then the rest of the world is like, we'll let somebody else do it. So it's hard to get those unless you have a lot of partners that will step up and everybody will go in and vote. But they do a lot of work with these type of grants. Like they love to fund community gardens, and they love things that work around nutrition.
My second question I had was the equipment that you have, the kitchen equipment. It's kind of like a mobile deal. So do you have it like in a plastic container that's on wheels, or how do you do? Okay.
Stanley that makes toolboxes, and Stanley has a giant tote that is on wheels with a big handle, and we will pack that with as much as possible and pull it. Right now I just have stuff in bags everywhere because we're only doing 2 or 3 at a time. So one of us will carry 2 or 3 burners, and then I'm able to put all my stuff into 2 bags, and we just carry it in bags.
Right, thank you.
This is Faye in Macon County. I have a question also. When you were talking about incentivizing the participants by, kind of doling out some of the kitchen equipment, have you pre-purchased maybe 10 or 15 complete packets of the kitchen equipment, and then at the end of their participation, they have actually earned everything one item at a time?
No, I've been putting them in there weekly right now, because what happens And this is particular to where I'm at right now, but what happens with our recovery community is they may be in treatment today and they may be in jail tomorrow. A lot of them are facing court, so they're in a program to try to avoid that, and then they're out, and I have to replace that slot with somebody new. So I'm trying to give them weekly as we go, so people will have that. But we are doing a marketing ploy with photos that I will show you in just a second, and they will be entered to win a cookware set. So we did set aside money for, at the end of the project, everybody that has participated by sharing a photo will have their name entered into a drawing for either cookware or a crock pot. It'll be a larger type item that we will give away at the end of that series.
Thank you.
All right.
Kristen, I want to make a comment about funding. Often your local Walmart will make small grants. So that would be another source, and because of your connection with food produce or food cooking, then you may even offer to that may even in addition to cash grant, give you a grant of produce to use in the cooking. So do contact your local Walmart. And then another partner to consider, Sharon, I know you're with the Extension Service, but those of you who are not with the Extension Service, I'd encourage you to contact them and partner with them, because they do these kinds of programs themselves. And one of the things that you can bring is more participants to the cooking programs. And if they're not aware of this type of program, you may interest them in it. And they also are a source for connection to grant funders. They have to get grants themselves. And so they may know of a funder that you and the extension partnering together, that usually strengthens your proposal. That's another source.
It is. We're in a big grant like that right now, Richard, with actually Walmart is one of the sponsors of the SNAP stretch. So they chunked out like $600,000 along with to be distributed throughout the state. But between that and WVU doing a program, we were able to do those pharmacy prescription boxes for clinic patients. So we partner with both. Very valid point. So and without further ado, I'm going to introduce you to these videos, and I will just tell you that this is when we realized how goofy we were. So I went into this, with the approach that this was for Richard and Sheila, and I wanted to be so professional and this is going to look good. And then we watched it and it was terrible. So we refilmed the whole entire thing with a lot less reservations, and we tried to be just like we were in a regular class. So you'll kind of get to see how that comes out sometimes, because I think as much as I wanted it to be perfect and I wanted it to look a certain way, like at the end, like we are who we are, and you just have to go with it and make it work for you. So if you get tickled, I don't care, because we have laughed and we have edited and laughed. And, look into doing things like this to get yourself familiar with being on camera and doing things live, because I do think we have a lot more opportunities that have opened up for virtual programming because of COVID. And I don't think those opportunities are going to go away, because you can reach such a broader audience. So this is how you can pull these up. You'll just go to your YouTube, you type in practice made perfect. Just like that. And those are ads at the top. But if you go right here, there's my frying pan. I'm going to click on the channel. So on the home page, when you pull it up, you'll see these, and they're in no particular order right there. But if you go to playlist, if you were doing these with the class and you wanted to play them in order, then you could go here. These are the educational lessons where it says lessons. And these are the demonstrations where it says demonstrations. So I'm going to let you guys watch 2 clips just because they're pretty funny.
In order to cook most of your meals at home, you will need a fully stocked pantry. With a fully stocked pantry, you will be able to budget and plan your meals. By keeping your basic items on hand and only shopping for the main ingredients that your recipe calls for, you will save yourself time and money. Let's look at some things that are always going to be used in basic recipes.
So when I said we covered everything, and these were very simple and concise lessons, I meant everything, because there are a lot of people that have no clue. If you look at people that aren't used to cooking for themselves, a lot of people live on gas station taquitos, is what we have recently found out, and fast food items like Taco Bell. So we really started basic with things like this, with the stock pantry.
Keep these items on hand at all times and keep track of when you run low so they can be added to your weekly list. On hand, you should keep flour, baking powder, baking soda, salt and pepper, sugar, light brown sugar and powdered sugar, cornmeal, cornstarch, breadcrumbs or panko, cumin, chili powder, oregano, basil, parsley.
So you get the idea, like we're very basic skills. And then I will go to, and they're all short. They're 2 minutes or less.
Blooming herbs and spices. Most people are familiar with adding butter and salt to their meals for flavor. But did you know there are many flavor profiles given from fresh and dried herbs and spices? Some of the most common savory herbs we use for modern cooking include basil, oregano, and parsley for Italian dishes, cumin, coriander, and chili powder for Latin dishes, and garlic for everything. There are also sweeter things that we will use, such as vanilla, cinnamon, cardamom, and allspice, to name a few. It's important when you are using herbs and spices to understand the difference between fresh and dried. You will often find that dried spices and herbs are more potent than fresh, so you can use lesser amounts. But you may enjoy the taste of fresh garden herbs more than dried. Adding fresh herbs at the beginning of a recipe gives your dish a softer tone.
So we're just reinforcing that there are things other than salt and pepper. You'd be surprised how many people do not cook with herbs because they don't know what they do, or they simply don't know.
In order to cook most of your meals at home, you will need a fully stocked pantry. With a fully stocked pantry, you will be able to budget.
Ooh, sorry. They don't know or understand. So we did cover everything as far as how to hold a knife, vegetable prep. There's even one in here on meal prep, like how to save money by doing meal prep and planning your meals and your store list. And blooming herbs, just things that we thought people would need to know that covers all of your bases. And then these are the ones where we actually do the demonstrations. Sorry. There are recipes too that go along with all 6 of these. You'll see the recipe cards when we get to the Google Drive.
Okay, we have a little bit of flour. We have put some salt and some garlic powder and some onion powder in there to give a little bit of flavor. And what we're going to do is we're going to lightly dust our steak, and we're going to start frying it in the pan. And what that does is that will act as a thickening agent later on when we're actually making our stroganoff. As you can see, I'm just kind of moving this around.
This is one of the ones that is not veggie focused. So hold on just a second. Let me go back and let you watch my favorite. But all these are for you guys to distribute and use and duplicate and put it out there and cook with it.
So today we are doing chicken and pineapple sliders. Sliders are really good for a quick lunch or if you don't want a really heavy dinner. So we chose these because you get a fruit and you get vegetables because you're going to top them with spinach, and you get your protein from chicken. King's Hawaiian rolls have a sweet flavor, and you're going to also get your carbs from that, so it makes a really balanced meal. So I'm going to start with our marinade, which is the juice of a lime and the juice of a lemon.
We bought boneless, skinless chicken breast with the rib meat because it's a lot cheaper. Just cleaning it off.
You should be able to get around 2 tablespoons of juice. roughly. Lemons have seeds, and we do not want them in our marinade. So you just kind of fish them back out as you're juicing. So my next step is going to be to add my salt and pepper. Okay, so we're just going to do, it says a pinch. I'm just going to. And I purposely did that and didn't measure it because you want people to feel comfortable in the kitchen. If something says to add a dash of salt, I don't want somebody to think they have to get 1/4 of a teaspoon out and measure it and do it that way. So some things may look like we're just on the fly doing it, but they were done with a purpose because we wanted it to be like you would do it at home in your kitchen. And the only reason I'm showing you this is because me and Rebecca are getting ready to have this interaction, and our little IT guy put music with it, and it's hilarious. So I'm just going to let this one finish playing. About what I think I would like. And we're going to whisk it. Nothing fancy.
And the good thing about lemon and lime juice is where lemon and lime juice has acid in it, it actually behaves, and even the pineapple juice, it behaves as a natural tenderizer. So instead of buying meat tenderizer, if you have any kind of acid, like acidic, oranges do the same thing, pineapples do the same thing, lemons and limes, if you marinate or incorporate that into your marinade, it makes all your stuff.
It actually breaks down the peptide bonds of the protein so that when you combine them in the fat, it makes your chicken still be moist and flavorful.
Well, that too, or it just makes it tender and you don't have to use tenderizer. Okay, we're going to put our chicken in our marinade, and then we're going to cover this up. We're going to set it in the refrigerator, and we're going to let it marinate for an hour.
Buns while you're waiting on the chicken, go ahead and slice those. Make sure you don't do it too thin on the bottom or you won't have enough sandwich to hold your sandwich. So Rebecca, what's the safe temp for chicken? Do you know?
At least an internal reading on a thermometer of 160 degrees. That's for chicken breast meat. For leg, thigh meat, it's 175. As you can see, our chicken is starting to get a little bit brown around the edges. It's moving, so it's ready to be turned.
Apple. We're going to put it on the bottom of your slider, followed by some baby spinach or green of your choice, and my onion, and a big hunk of chicken. It's a good one. And you might have to break that a little bit more. And then we'll get this pineapple. And we have made the best little slider you've ever eaten.
So you gotta smash like, subscribe, click the links down below so I make it time.
So those videos will play one after another if somebody is just sitting at home watching. If you just let that keep playing, it'll go right into the next video. But for you guys to distribute, you will just go back. If you're filming them, I mean, if you're playing them from your laptop or the iPad or whatever, you can hit them in order, just like that. But let me go over and I'll show you where all this content is housed, where you guys can reproduce like the actual scripts if you wanted to print and put them in your meal kits, or if you wanted to do it as a hands-on class. Let me go back and I will show you that. That would be somewhere. Okay. You see our Google Drive? Everybody good?
Yep.
Yeah. Okay. So Google Drive, Virtual Cooking Educational Lessons is the name of the folder, and the link that we give you will take you directly into this folder. You won't have to sift through my Google Drive. But all of the lessons are typed out. You'll see them 1 through 8 right here. So if you wanted to, say you wanted to do these as a handout and teach it from an in-person class, then you can print this however you would like to do that. You can go in and print it, but everything that I said and everything that was on the video is going to be right here in each one of these handouts. All the way down to the recipes. So if you'll look, you'll see homemade chicken noodle soup, herb chicken and grits. These are some of the ones that we've done so far. So I have videos online for 6 of them that are the core of the class, which were ones that we had public feedback on, and we got everybody to vote on those, which is why we picked them. But I'm going ahead and doing recipe cards for the 24 that I'm using for this program with Palatine, where we're doing meal kits with our recovery. So you'll have access to 24 different recipes if you want them. They just we don't have 24 different videos because that would be a lengthy program. But there is a basic template that we used, and we were able to go in and just sub out. And I don't know if I can get you that template because it's done through Photoshop and it takes forever to change it. If you're not Photoshop minded, I have a hard time with it, but my IT guy's been doing them for me. Those are all in there though, like the 6 that we feature on the videos. You'll see a recipe card for each one of those. Then there's some tips and sheets in here for people that are going to use this curriculum. So here's like little tip sheets that we've been working on, and all this stuff will constantly change in the drive, and it'll be updated as we go and as we see what's been working and what's not with the virtual. But you'll have access to the whole entire folder. So whatever you all would like to use will be there. I even have a sign-in sheet in here ready. So if you're going to offer the program, and the reason that we did the sign-in sheet is because I will tell you, on the very first week, you have to collect everybody's information, of course, and you want name and age and all your demographics and whatever data you're collecting. But when it got to distribution time, we keep one of these by the cooler. And every time somebody picks up their bag when they leave for therapy, we write their name down. Well, now we've been able to see who's not picking up their bag. So if somebody hasn't picked up their bag for 2 weeks in a row, I don't want to say like we give them the boot, but that's valuable money and it's food that can be wasted, and we don't want that to happen. So after somebody has not came by twice in a row to get their bag, then we have been replacing them. But this has been an easy way for me to mark who picked them up every week, check it off, and then you can see if there's a pattern. Like, oh, we only had 1 person that didn't pick up this week, or I had 7 people that didn't pick up a bag last week. And it's just good for you to track if you're going to be collecting data for things. So that access to the sign-in sheet is there. You don't even have to make your own sign-in sheet. Like, we'll just take care of all of that. Then there are some other handouts through here. There's a study guide that will be for trainers. And when Sheila gets all of these train the trainer events scheduled, which will be a more in-depth look of what we just did pretty much, we'll go over some of these other, but like the study guide will be right there. So if you're the trainer, you just need to watch the videos and familiarize yourself with the content and then go for it. And then the last thing I wanted to talk about was we used a lot of Facebook and a lot of Instagram. So if you, what we did was we told people to use the hashtag practice made perfect so we could verify that they were cooking. So the only other way to tell if somebody is watching your videos is to tell them to go comment on your Facebook videos. And you really didn't want to make people, or on your YouTube, we didn't want to make people go just write a comment and not watch the full video. I feel like it's really redundant and it's basic, and I don't want people to feel like we're treating them like a child, like, oh, you have to go make a comment. So what we did was we told them to take photos of whatever they were cooking and use the hashtag practice made perfect. So we could see and we would know if we are getting feedback. So between Facebook and Instagram, we have this, she made a full-on video of cooking, but we have people that are sending us, we're getting feedback. So you can see all these are kits or people that are in recovery. Because like I said, it's our pilot. So I'm getting to see now people are making these and they're all just trying to win some cookware for later on. This woman made our chicken noodle soup, but apparently she got confused on pictures and she put a picture of her cat. But in the comments, She talks about how her cat loved the aroma of the chicken noodle soup that was cooking. So I am guessing, see, he loves the aroma of the fresh produce. I don't know if she got confused that day or what, but you'll have to sift through if you do like we did. This is one of those failing forward moments where I realized I picked a hashtag that was kind of vague, and we probably should have made it something like WHWC, practice made perfect, or something that would have been very particular to our program. So if you were doing this from, McGoffin County Diabetes Coalition, I would pick like MCDC, practice made perfect, or whatever you can do to make it very personalized for your clinic. If not, you're gonna have to do like I did and sift through a whole bunch of other stuff too, which is fine because I did find more photos down through there from other people. But that's been a good way for us to interact. And then, like I said, the younger people love the Instagram. So, whoopsie. You got to familiarize yourself with technology. Like you've got to use technology. I know a lot of people don't. Yesterday, we had a woman in the first breakout session that was really interested in it, and she liked the idea of it, but she really didn't want to do it. But if you're going to reach the younger population, you've got to do it. So our farmers market is really funny. We have this huge following right now on Facebook. Right now, there hasn't been a whole lot of activity going on. So I've been filming my chickens at home on the weekends. So every Saturday they get a chicken update, and our Facebook has like blown up over the last few weeks. It's really funny. Our Instagram too, we went from like 80 followers at the beginning of 2019 to now we have like 700, I think, or 680. So you've got to get creative, but all this is doing is making people more aware that they can come to the farmer's market and get fresh food, or that they can be a vendor and they can sell their food at the market to make extra money, or the agriculture is cool and it's cool to have chickens. Like I'm just trying to promote food. But we also had that same hashtag. So you can tell I've already typed it in. If you pull it up on Instagram, I don't think we have as many over here. I think we only have one, but I realized it was this guy's band midway through the first 2 weeks that we did this. But if you go down through here, you'll see food, like right in the middle of all this. There's some food pics. So pick a hashtag that is personal to your program so you don't have to sift. But, like this one I thought was awesome. Like that is a good looking bowl of white chicken chili. And then there should be one right behind it with his one pot quinoa dinner that nobody knew what it was. And everybody swore they didn't like chickpeas. And then they were all like, I ate those chickpeas and it was great. So there's the chickpea and quinoa skillet dinner. There's a few down through here, but like I said, not as many, but it gets people motivated because you're telling them that they're going to win something. And then you're getting the word out that you're doing food. This one I don't get because there's no soup in his soup, but this was our chicken noodle soup. And I know that because I know that he's in the program, or I wouldn't know for sure. I just don't know where his soup went. It's just like a bowl of noodles. But I am getting feedback. At least they're cooking. You know what I mean? I don't care if it looks terrible or if they don't. It really doesn't matter because I know that they're not eating fast food. So that's one meal that they're getting around the table that is less preservatives and less things that they don't need. But make yourself familiar with your social media tools. And I'm open for any other questions that you guys might have. Or not.
I look forward to watching more of your videos.
I said we just embraced how they came out. Like I wasn't pleased with all of them because it is pressure when you're used to just doing a Facebook Live. It's totally different than paying someone to come in and be a videographer. And we had to do like a 2-day session one week And then he had to come back the next week. And then there were still things that we didn't like, but I've come to accept that you just have to embrace who you are. So even though I despise the way I say chicken on that video, because I know how it sounds and I know that we're perceived as not smart sometimes because we talk slow and because we have an accent. It is what it is, and we're going to reach the demographic I think that we want to reach by being ourselves, not by trying to come off as professional. I want to be professional, but it is just me.
What state are you in?
I'm in Southern West Virginia.
You did say West Virginia several times. I'm sorry.
Kristen, this program is for rural Appalachia, and it needs to reflect the culture and the language. That's why on my team, Sheila's critical because she speaks the language. I don't. Regina speaks the language. Catherine speaks the language. It needs to be for our culture.
Even our music. Like we even sat and picked out the music as like, you know, the banjo type music or something that reflected what we thought was here and filmed our mountains. Like those mountains are right outside, you know, things that we thought would kind of give it the feel of, because it's not like, I think when you're in the clinic, sometimes you have the standpoint of food as fuel. And we tend to look at things as why can't everybody understand this is cut and dry? You don't eat this and you eat this. But food is really personal for everybody. It is a very interpersonal relationship that we all have with food. So when you start thinking about like people hide when they eat snacks, you know, people go out to eat, but they don't want everybody to see what they're eating. So people will eat stuff at home that they don't eat in public. It's just our relationship with food is a lot different than just food as fuel. And I think we wanted to reflect just everybody coming back around the table. We really wanted to focus on people coming back around the table. And the more you cook at home, even if you're not cooking great food, even if it's meatloaf and mashed potatoes and macaroni and cheese and rolls, because that's what people do here. And they put food pics on Facebook and I'm sitting there going, that's 1, 2, 3, 4 carbs. What's wrong with you? I don't put those things online, but I'm thanking them, because I think that's just your clinic mindset comes in, and it's like, no, food is fuel. But the other side of me knows that I do go home too, and I eat cookies sometimes in my bedroom where nobody's looking at me, so they don't know what I'm eating. We want to encompass both sides of that and make people feel at home and natural when they're in the kitchen. And we do tons of stuff. So if you guys need any other resources, or if you have any other questions, like we do pharmacy, prescription veggie vouchers. We just revamped our prescription veggie program. We do run a mobile market. I work on the side with Fresh Start, which is an agricultural based program for people in recovery. And we are doing some garden therapy with them. Oh my God, it's just anything that you can think of that revolves around food or the garden access, then I could probably point you in the right direction. I feel like somebody might want to teach this somewhere. Like somebody. Nobody? Janet, you look like you might want to teach this.
I'm definitely considering.
So tell me, okay, go back. I guess I wasn't paying attention. So you were doing this with the rehab, but the folks in rehab, they don't pay for it. But do you track them? I know you said you collect that data when they sign in. So are you just collecting, yes, they picked up their bag of food, or are you collecting other things?
We're collecting lots of other things. So we were trying to address food access with a population of people that is often missed for food. We are also addressing nutritional barriers. We are working on reconnecting families. And then of course they're in treatment for substance use disorder. So we are tracking, we've done pre-surveys, and when we have a pulse check next week, and then we'll do a post survey on everything as far as where do you typically shop, to do you normally buy produce? What are the top 5 foods that you buy every week? You know, if you use SNAP benefits, are you aware that you can double your SNAP at the farmer's market? Do you often shop at convenience stores? Do you eat most of your prepared meals at home? We're talking to a lot of people that don't have a home, a lot of people that are couch surfers that don't have a home kitchen. So we even asked, How many nights a week do you get a prepared meal? Do you often eat your food at somebody else's house? Like, we're trying to track a whole picture. And then as far as on the data side, you know, we did basic like height, weight, BMI. And then when we do programs, so you can tailor this when you're right. It depends on how you want to write that grant. You could do this for seniors, and you could track A1C, and you could track BP and say, okay, we did heart healthy meals for 10 weeks and their BP went down to blah, 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 or their A1C decreased by 1.1 points, or whatever you wanted to do. You could set it up to track it that way. So
Okay,
it could really be multi-purposed.
Okay, as far as I guess I'm wondering, how do you know they're participating? Do they have to watch the video and prove they watch the video, then they get the food, or are you just handing out food? Do you know what I'm saying? How do you know they're?
So at this exact moment, I don't know that all 40 of them are participating, but we're trying to affect, it depends on if you're looking for quality or quantity. So decided on what kind of data you want to collect. I was looking to affect change. So we wanted to set it up that it was weekly. I feel like if you give somebody, you know, a veggie voucher and say, here, you need to spend $30 of this per month, they can go buy all that in one day, and it's not going to create effective change in their health because it's not a weekly habit. You know, so we set them up as a weekly bag. I can't verify that they're all using them, but when they pick them up, we sign it out. So I know that they're all picking them up every week. I think we had 4 that didn't show up last week. And so there are, but like I said, with that particular population, it's just challenged because they can be in jail this week, or they can be back in rehab in an interim facility. So it's kind of, it's going to be difficult for us, but that's what the photos are for. So we do have them to take a photo of the meal with that hashtag. They don't have to, but there is free Wi-Fi access and iPad access anytime they come into the clinic. A lot of them have been sending photos to their particular caseworker. So they'll just send their photo back to their therapist if they don't know how to use Facebook or Instagram. And then 10 of those bags do not go to our clinic patients. They go to our sober living house, where I get feedback from them on a weekly basis because I go into their group. Like, we actually go into their group therapy sessions once a week, and we can come in and talk to them about nutrition, and they'll tell me, oh man, Tina made that food last week and it was good, or so-and-so made this. And they're fairly honest about what they're doing and who they're sharing with. And the good thing there is, if it's 2 roommates that are getting a bag, like, one of them won't come and get it. Well, I'll just eat with her, because we're putting enough food in there for a family of 4. And you're looking at people in this particular facility, there is shared kitchen space. So like, each room might have a refrigerator and a microwave, but there's a kitchen on each floor. Boys and girls are separate. And then you've got mothers or expectant mothers on the top floor. So everybody kind of shares a kitchen depending on where they are. Well, I noticed last week we gave out zucchini and squash, and like 4 of them come up to me as soon as they hit the door and was like, hey, I didn't like that zucchini, but I gave it to Tina and she fixed it. Well, everybody on Tina's floor ate zucchini that night because she ended up with like 8 zucchinis that she diced and fixed up with her squash. So I don't think that it's going to waste, but at the same time, I'm sure there are other things that we will learn as we go that you could put in place to make sure that they are fixing it weekly.
Could you add something in there so they could freeze it if they not going to be able to use it?
There's a lesson on that. The last educational video is on food preservation. And we did cover freezing just because it's the cheapest. You know, everybody's not going to have a canner. Everybody's not going to have access to afford jars and lids. And if you can find lids this year, things like that. So we did cover freezing, and we actually demonstrated like buying fruit, and you can freeze blueberries is what we did, or buying old bread. You know, I buy 50-cent French loaves at Walmart all day long, and we'll take them home and put them in the freezer for when we have an event or when we're having a dinner. We covered all of that stuff in that particular video. Because I think with the double SNAP, you know, if our state keeps doing that, that's very important that people do know that they can preserve that food.
It makes great breadcrumbs too.
Kristen, I have a question. This is Eric. maybe you mentioned this, but I wondered if you're connected to your community health workers in Williamson and if you've been able to target some of this to their patients.
I do work right in the same office with our community health workers. So we have not piloted it over there yet, simply because we just finished these videos 3 weeks ago. Like, it is brand new.
Oh, I didn't realize it was that new.
Yeah, like we just got everything finished, and we started doing the meal kits actually the week before everything was completely finished. But we did, we had 1 or 2 on there where we could say, oh, okay, go like this channel. And we knew that they could go in and subscribe, but all the content wasn't even there when we rolled this out. So I think what we will be doing after we go through this test pilot is people that are on our community health program. And if our Aetna partnership continues, Aetna has their own, so we're in with Aetna too. I would like to be able to do it with the meals being tailored to our diabetics or to our people, that are healthy heart, healthy lives. We're in healthy heart, healthy lives. I think it can be tailored to all of those, because you could always go in and change the recipe to make it, most of these are low carb, just by default, just because we tried to pick healthy stuff. But you could definitely adapt and do your own recipes and come up with your own recipe card and still use the core content. Yeah, see, they've not been allowed to resume in-home visits yet. They have done a few, like our very severe comorbidities, but like for the most part, they're not going back in home.
Right. They seem like a good population to try to target because you already know they're kind of engaged or they wouldn't be in the CHW program in the first place. So
yeah,
seems like a great opportunity. You're doing great stuff. I'm really impressed.
Oh, thank you. Well, I just hope you guys all leave the Zoom and cook today for yourselves. A very nutritious meal.
Okay, we got about 20 seconds until we get to the main hall.
That's fine, Kevin. Just kick me out. I'm finished.
Thank you. Excellent presentation.
It was great. Audio Working, Deb?
It was a minute ago. Hopefully it still is.
Sounds perfect right now.
Good. I have a conference line ready if not.
Hey, Deb, I will say the folks at my session were so kind because I had something that has never happened before. I didn't have my laptop plugged in and my battery ran low. So I had to run and get my battery. Oh. My dog was barking. So thank you all. Bit embarrassing, but we prevailed.
I think we've learned to adapt because we're at home. So I'm used to hearing dogs and kids and people walking in the background. It's just like, okay.
No, my house, you hear a rooster and a duck and who knows what you'll hear. Anyway, welcome back, everybody. So we're going to do another quick break with Sheila with some gentle yoga, and then we've got a couple more great presentations from our coalitions. So Sheila, I'm going to hand it over to you.
Okay, can you guys hear the music?
Low.
Yeah, it's a little bit low.
A little bit low? Okay, I'm going to turn it up just a little bit.
Better.
Is that better?
Yeah.
And you can still hear me?
Yep.
Okay. So I want you guys to remember the whole point of gentle yoga is to go nice and slow, right? Be kind to yourself. This is not Zumba, and I am not Regina. Regina lives in the fast lane. Sheila lives in the slow lane and likes to take one thing at a time. It's easier on the brain, okay? So we'll do just a few minutes of this. If you'll just go ahead and close your eyes. And just allow yourself to relax your weight into your chair. And just breathe. Go ahead and relax your feet and your legs. And just allow your hands and your shoulders to relax. And just breathe. Go ahead and take the tongue off the roof of the mouth and take 3 deep breaths. Now place your hands on your belly and just practice receiving the belly as it inflates outward like a balloon. And do this while you're inhaling. Let's take a deep breath, pushing the air into the belly. And then as you begin to exhale, slowly draw the belly away from the hands. And exhale all the air out your mouth as if you were blowing out a candle. Let's do that one more time. Just breathe in through the nose, inflating that belly. And now exhale, drawing the hands away from the belly, pushing all the air outward as if you were blowing out a candle. Good. Now as we move into stretching, remember to stay aware of your breath. Also remember no pain and no strain. All right? So we're going to start with some shoulder rolls. So go ahead and sit up kind of tall. Remember, no pain, no strain. I just had shoulder surgery 3 weeks ago today. So let's place our hands up on our shoulders. And then in one direction, just slowly begin to move in one direction, forming big round circles. Awesome. And now in the other direction. Now remember to breathe. Opposite direction. Awesome. You guys look great. And we'll even it out and just go in the opposite direction one more time. Okay, you can relax your arms. And then let's just bring our shoulders all the way up to the ears because this is really going to help us reduce some stress where we seem to hold it all the time, and just go ahead and relax the shoulders. Good. One more time, up with your shoulders towards your ears and just stretch, lengthening the waistline and relax. Awesome. And now we're going to do what's called a weight machine. And this is a great exercise to help you strengthen the muscles that you breathe with your lungs and things like that, and all those chest muscles. Okay, so let's bring our hands up in front of us, elbows bent. And then let's just go outward with our arms and elbows, drawing those shoulder blades behind us. And now close. And let's just do a big inhale right here as we open wide. Take the tongue off the roof of the mouth, guys. And close as we exhale. One more time. Open wide. Remembering to breathe and close. Perfect. Now I'm gonna get you guys out of your chair. I'm not gonna pull any Zumba on you or anything like that, but you guys can go ahead and stand up. I'm gonna bring my chair back here so you guys can see me. I think you guys can see me, okay? Okay, and now we're gonna help with our balance here, all right? So we're just gonna hold onto our chair for support. You can. And then let's just lift up on our toes and just hold that and tighten your muscles here in your upper legs. That's really gonna help relax your bottom half now too. And also help with balance. And come back down, feet flat on the floor. Let's all stand again on our toes and just reach, stretch those toes. Hold that, and now relax. Great. Now let's do some foot flaps with one leg outstretched in front of you. Let's draw our toes back toward our chest. And now point down toward the floor with your foot. Good. And just round circles. This is really great for arthritis. You might hear some popping and cracking and things like that. You can go in the opposite direction now. Awesome. Opposite direction. Just move those ankles around and relax. Let's do the other side now. Leg outstretched. Point those toes toward the floor. Draw your toes back toward the chest. Awesome. Okay, and now just slowly begin to move those ankles. Not your hips, just the ankles. And it's freestyle now, guys. You can do whatever you want with your feet. Great. Okay. Relax. And you guys are done.
Thanks, Sheila.
Yeah, thanks. That's great.
Welcome.
All right. Well, as we come back together, and I think we can all are relaxed and can focus now, we've got a couple more great presentations from our coalition partners. So I would like to introduce next Alexis Batasa from Mingo County. And Alexis, I don't know if you can share your screen and if you have any PowerPoint that you want to use today.
Yeah, he's with me. We've got
Okay, all right. And talking about active living during the pandemic.
Yeah, I told you all that we do a little bit of everything. So
We
this is
do
the other side. Yeah, this is the
that
other
we know.
side.
I will hand it over to you all.
Okay. Yeah. You ready?
Yeah.
Okay.
Hi, guys. Good afternoon. It's good to see everybody. I know some familiar faces here. But today we are doing the active living opportunities during the pandemic. Let's just flow into it. It shows here at Mingo County Mountains became our backdrop for a new hiking concept that we have called Hiking for Health. New program during the virtual world and using Facebook Live to interact with our fans. As you can see, of course, Sheila just did Jinta Yoga. We've been doing this here the past couple months, virtually, just kind of recording our own selves with our coworkers here in the background. And we've been posting on Facebook, on our Healthy in the Hills network page, and also on YouTube. So we do get a lot of viewers to check this out. I do know that we're going to hopefully here in the next few weeks get back in person doing this with the public. So we're getting very excited about that because around the time when I was doing this in late 2019, early 2020, I was getting a good turnout of 12 people. So it was good with the ages from as young as like 25 to up to 70, 80 years old, and they loved it. So I'm looking forward to seeing their faces again. Right here we have the health and fitness corner with Mad Dog. So we've been working with one of the trainers there at our local gym. It's called City Gym. And we thought it'd be a good idea to just kind of still where people are not, leery about going back in the gym or anything, when it comes to fitness. We started doing these videos with him, and he coordinated a lot of this with different types of activities each week, such as doing abs. You can see here we're working with one of the yoga instructors in our town. Her name's Heather. Do a lot of circuit training, obstacle course stuff. And again, we use social media with Facebook and YouTube to share all this information. And again, like I said, you can check this stuff out on our Healthy in the Hills Facebook page. You can see more of Mad Dog with his recordings.
And we have these on YouTube also. So we have our own channel for workouts. If you, actually, we can probably link to that later.
Yeah.
But it's Healthy in the Hills is the name of the channel, and it will pull up all of our active living videos.
This one we tag team and some other community members. This is called the Hiking for Health. We couldn't do this without the Powhatan Foundation of Huntington, West Virginia. Oh, you're good.
Oh.
But we have 7 different hikes throughout our county here in Mingo County. And the goal was for our participants to complete 5 out of the 7 hikes. And pretty much this is our backyard, the mountains here, the Appalachian Mountains here in West Virginia. And we had people from all ages check them out. The idea sprung from when Kristen and them were kind of seeing everything going on during the pandemic. Like every day you will see somebody park on the side of the shoulder on the highway to go up one of the hikes called Death Rock, which is pretty much overseeks downtown Williamson and over into Kentucky. It was the idea kind of brought this to their attention and thought, hey, we can do this, especially in the fall of 2020. And then we're just now finishing up here in our spring session. The cool thing is we had the first session was about 20 completers, about 44 people participated in the program. This year, this spring, we had about almost 100 plus, just to say. But we worked a lot more closely with our recovery community, as like Kristen was talking about earlier. And they really enjoyed it a lot, especially when it comes to the mental health aspect to it. A lot of them didn't think this was going to be fun or this is going to be, excruciating because something different in the trails, but they really enjoyed it a lot. Even like yesterday, we took out our employees here from the wellness center. And again, like I was saying, a lot of them were like, oh, I don't know about this. I'm out of shape. But, those same people who said the same thing just really had a great time. It was so fun.
And you can see the diversity in some of these photos. Like in this first photo, you've got generational hikers. So like we had a mom that came out with her sister and both of them brought their kids in that photo on the right with Alexis. And then over here on the far left, you'll see that's our CVB director from Williamson. So we partnered with our CVB directors because we wanted to capture that tourism aspect too, because a lot of these rocks are on Hatfield-McCoy trails. But if people are just riding the trail, they would never see this. Like you would ride right by and not know that it's got this viewpoint or that you can go out there and climb and play. So we tried to pick spots that we would be able to market both ways for locals as well as for tourists. And we have put maps out in all of our bed and breakfasts
BBs,
and our trail houses. Our Chamber of Commerce has these maps. So these are just some of the different, they're all different too. Like all the trails have a beautiful, that Death Rock right there on the left is the one that it's probably everybody's favorite, just because it's always a different view.
Yeah, the seasons. Oh God, this is different every season.
Yeah, that one is in the fall on the right, and on the left is in the spring, isn't it? I can't tell.
We love to take you guys on a hike.
Okay, that one is because I had the Hell's Knob hike on Halloween Day. So how do you go to a hike on Halloween Day on Hell's Knob and not be dressed up? I mean, it just made sense. So like we take turns leading different hikes, and then our CVB directors lead some of them too. That's a good one too. It's probably one of my favorite hikes.
Kristen can jump in more in this one. This is called the Wolfpack Walk. This is pretty cool. We do have a video, so you guys can check this out. You can explain more about it.
Where did it go?
I don't know. Bear with us.
I want to take you through the hyperlink if it'll let me. It might not.
And we did have a question from the chat box. What was CVV?
It is the Convention Visitors Bureau. I don't know if you guys have that in your states, but we have it here in West Virginia. It's pretty much just promote, they say heads on beds. So just get more people to, you know, lodging purposes, just get people to stay here in our communities.
Oh,
like tourism, like your tourism bureau?
Yep.
Okay,
Mhm.
got it.
Yeah.
Got it. Thank you.
You're welcome.
I would love to show that hyperlink, but I don't know that I can screen share. It might be because it's screen sharing and you're going out of that screen. But
I think what you can do is you can end the slideshow, and when you see the PowerPoint, you can go in there and highlight the text.
okay, I might do that in a
Paste it.
minute. Thank you, Kevin.
You're welcome.
I bit the idea though off somebody from here from the diabetes conference in 2018. So you guys have already seen it. But we worked with a bunch of kids at our local elementary school to pilot a program that we called Health Ambassadors. And our health ambassadors were middle school kids that we pulled a boy and a girl from each class, grades 5th through 8th, and we sat them down and said, what can we do to you, what can you do to encourage your peers to eat healthy and be more active, and mental health benefits, like what things are important to you. And the teachers actually picked the kids based on people that had a good relationship with their peers, and kids that were active in sports or active in clubs, and people they thought that their peers could relate to. And they came up with, which we helped kind of co-design, a walking trail that was like the storybook walk. And that was something that I saw at the diabetes conference in 2018. So we did our own. It's called the Wolfpack Walk. And we have 18 posts up around Williamson Wolfpack, the grade school down here, that tell the story of Peter Cottontail at the moment. Why is it doing that?
No, it's weird.
Like it won't, it says end of slideshow, and that's not the end of the slideshow.
Yeah, let's go down, move that box. There you go. And then
why?
It's the Wi-Fi.
It's the last slide.
There's no more slides. Like, where'd it go?
Our slides disappeared.
Like, where's the rest of the slideshow?
I don't know. We can explain other things. Sorry about that.
Well,
I pulled up some stuff from my slides.
Go ahead.
Okay.
I'll just keep looking over here.
Okay, so some other programs that we've been working with for a while. I know that Kristen mentioned to me that one of you guys have been doing a challenge, like a virtual walking challenge, which is pretty fantastic. We've been doing this walking challenges. The first one was called the Lunch Walk Challenge, and we did this back in 2012. And it's pretty much just get our community, more active, more just walking, and kind of compete with other businesses, churches, different communities, and so on. And it pretty much, it went from just our own small community and pretty much walking all the way to California. I know one year we met up with a real city there that communicated with us called Marin City near San Francisco. And they literally, they walked the same thing, this path, but they literally drove all the way to Wilmington a couple of years ago. I think it was like in 2014. And it was pretty cool just to meet those folks over that ways. To come and hang out with us and just kind of doing the same thing that we're doing when it comes to health. Another thing was the Healthy Feud. Of course, with the Hatfield McCoys here in this region, we thought it'd be fun to kind of designate this team of people or individuals at the Hatfields or the other team as the McCoys, and they kind of compete against each other as individuals or teams, and kind of like who would win the most miles out of each group. And we had a website. I don't know if they're still live, but you can check them out, healthyfeud.com or lunchwalkchallenge.com, and gives you everything pretty much live. It's live and everything, just to put all your mileage to collect each week. We usually ran the program probably for about 6 to 8 weeks, and then we kind of do a thing and celebrate the winners and stuff like that. But really, the celebrations is people getting active and moving. Another thing that we always keep doing since 2012 is our monthly 5K races. I remember when we did this, we did a race in honor of my mom. She passed away that year. And we did the first 2 months was like free races. So we had like 63 people that came out in that first time. And then the second month we had about 80. And then so on, we averaged about 120 something people. But I'm also the president of this our running club. It's called the Tug Valley Road Runners Club. Check us out on Facebook. We pretty much, like again said, monthly races. We're well known for the Hatfield McCoy Marathon. Check that out. That's coming up here soon, in person. Hopefully everything goes well. That is on June 12th. We also do 10Ks, half marathons. We jump more into the ultra marathon distance. So we're doing like 50 to 100 miles, which is pretty much a loop course that individuals from all around the country come here and check it out. We just had our race in March, had about 80 something people. So that was our first in person this year. And our second in person this year. And we were pleased just to have that many individuals from like 20 states that came here and had a great time. Workplace wellness. We've been doing that here the past couple of years. Pretty much just getting employees moving, being active. We've been doing different challenges such as a water challenge, kind of drinking, as much as water, the recommended for a day. We do some exercise challenges. I know I did one where we had to do like a bunch of like circuit training, like planks, sit-ups, push-ups, all that jazz. I know we're going to do one here with the employees soon, a 5K. So we're going to bring that to them here real soon. Active living with the recovery population. Of course, as I mentioned, we take our friends over there on the hikes and do different activities here soon.
We
especially
did
like the
gentle
scavenger hunt.
yoga.
Yeah.
Gentle yoga does well with our recovery population. We did a scavenger hunt. Like we went through some old Williamson history because most people that are in the sober living home are not residents of Williamson. So we went through and like made a list of access points for things in town we could do and took them on a 2-mile walk where they had to like find historical points for the city.
Yep.
And
cool.
I think if I can get together with some of you all, because every year when I see line dancing, I want to do it here. I think we're going to try to do line dancing at the sober living home and let it be like peer to peer, because a lot of their therapy is peer to peer groups. I think we're going to try to let them pick a dance and one person be like the teacher and teach us as a group each week and do it. That's my next project down there.
That's a good one. I like that. So yeah, we got a lot going on with the recovery community and we're looking forward to doing more with them. Schools, like she mentioned with the Wolfpack Walk, we did some other activities before the pandemic, like the Fitness Frenzy. I work with a principal from a school called Birch, and she had the idea of like, what if we just bring people from like City Gym, the yoga instructors, Zumba instructors, the Road Runners Club,
Dance,
CrossFit, dancing,
we had a ballet
ballet,
teacher come
together, and we kind of showcase, like do demos with the kids and kind of rotate every 3 to 5 minutes, just showcasing what is offered in the community that they're never exposed to. And we did this in every school and it was very fun. It was
like the kids don't sit down from the time they walk in to the time that they leave.
Yeah.
They just rotate between different things because a lot of kids don't want to do organized sports or a lot of kids don't feel like they're athletic. So it was really cool to see like little kids over here doing karate and then 7 minutes later they're doing ballet. Like they rotated the whole entire time and we were there all day. We couldn't move the next day after the first one because we worked with every group that came in for PE that day. But we did those at every school in the county in 2019 and it was great.
It was so fun. Another thing we did too was called the health trivia wheel. So pretty much it was like a wheel with different subjects.
On Amazon, right?
Yeah, you can get it on Amazon.
On Amazon, we bought that wheel for like $50.
So it's like heart health, cardio, not cardio, that's the same thing. What else was there? Brain stuff. It's pretty cool.
Yeah,
so,
it had some nutrition and some weight training, just a little bit of everything.
So the kids had to answer the questions. If they get it correct, they got points. They were going against the other team. And as his extra credit, they would have to do an exercise. So like say we do a bunch of push-ups and they would get a point or, and so on. And it was good. It was fun. Yeah. We did that almost every school too. I also did gentle yoga with the schools as well. Skip that part. We talk about the Spring Into Fitness Spring Break Camp.
We know there's a lot of people that work during the spring break. So, which we didn't have to worry about this year because my kid only got 2 days of spring break. But normally you have a whole week of kids that are home with no parents, or, you know, they have to find childcare. So in 2019, we did a spring into fitness camp. So the school let us use their gym. And during that week, we were like free babysitters for 6 hours a day. And we did breakfast and snack. And then we had like mornings were for mornings, we did a lot of inside things that were focused on physical activity, and we covered nutrition. And then in the evenings, we took them outside and we gardened, like we let them plant, and then we did them, took them on the playground and let them play and did some games. And we made the Hungry Hippo thing that you've seen on Pinterest or on YouTube with the laundry baskets. We just did basic stuff that you don't have to have money or equipment for, just to get kids to physically play, like just to have them move.
Yeah.
That was the same year we did Run with the Pack too, wasn't it?
Yeah, that was with your daughter.
Yeah, we did a running club too at the school.
Yeah, it was pretty much 6 weeks. Well, 6 to 8 weeks. We were getting ready for a race that we put on called the Cause for Paws. And the girls and guys were just training each week. We were following a program of how many minutes per week. And they got to do the 5K, and I think they helped design their own t-shirts.
They did.
And we also, you know, our race, we do offer a medal, so they got their finisher medal and a finisher shirt. So it was pretty cool to see them accomplish something after training for like 6 weeks or so.
Yeah, it wasn't like the big crowd that we wanted, but we did have kids that consistently ran. Oh, 2 minutes. Okay. Hey, guess what? I got it.
We got the video.
Yes. Hold on.
Okay.
I have no sound. What do I have? Oh, okay, hold on.
Oh, yeah.
Why the West Virginia Lottery, WOWK13.
I had 2 minutes.
Now, a new grant in Mingo County hopes to move the needle on the obesity epidemic by encouraging students to stay active. 13 News reporter Lily Bradley explains how, new at 11.
Here in Mingo County, the county was just named a gold county for the Healthy People, Healthy Places initiative. And despite the coronavirus, their healthy lifestyle plan is taking off one step at a time. Kylie DeBoard may only be 11, but she knows the importance of staying active.
I play basketball because I have like an awesome coach. And then I play soccer because I've played it since I was 3.
And now she's hoping to encourage her classmates to get out and get moving as well. She's one of 8 health ambassadors at Williamson PK8 in Mingo County.
Our students got together with the Williamson Health and Wellness Center. They approached us about creating a kind of like a healthy coalition as like a pilot school so they could take it to the other schools in Mingo County.
The partnership included a grant for a new project, the Wolfpack Walk Trail. It's a book trail circling the school where people can follow the pages of a storybook. By the end, they've walked half a mile.
And while Peter Cottontail is the story inside of this box right now, it can actually be changed.
So what we hope to do from here is encourage the teachers to check out the key from the library and maybe implement this walking trail to do some actual non-traditional classroom work.
A number of different uses with the same goal in mind, encouraging a fun, but more importantly, a healthy and happy story.
And what's really cool about that is we just got all the supplies in to put a second one in at Kermit, which is another rural place in Mingo County. That should go in sometime next week, if I'm not mistaken.
Yep.
And then Alexis also just got funded for some circuit trails. Like
Yep.
we just did some really cool signage to do like fitness trails on our existing walking paths too.
Yep, in 5 different communities. So we're looking forward to the next few months. And yeah, this is some of the things that we're doing on our communities, guys. If you have any questions for us, we'll be helpful to answer them for you all.
Great, thank you so much.
Thank you.
So anybody, if you have questions, we've got one more presentation. If you can go ahead and pop those into the chat box, we'll come back to those. And I would say that in terms of active living during the pandemic, we've heard from many of you the innovative things that you're doing. So as we continue to move to our next presentation, if there's something that you've done in your coalition that's innovative, go ahead and put that in the chat box too, because that'll allow you to connect with each other after the conference today. So if you have a program or something you implemented go ahead and pop that in there and we can make sure that we share those out with everyone afterwards too. So thank you very much. So we have one more presentation today, and I do want to hand things over next to Charlene Cook from Wyoming County, who's going to talk about happiness is the MOC. At the MOC is dancing with our friends. So Charlene, I'd like to turn it over to you now.
She's going to do blind dancing.
Charlene, you're muted.
Not sure. Do you have PowerPoint, Charlene, we need to put up?
Sorry, you're still.
My name first, excuse me.
You got it.
I'm sorry. I'm sorry. I thought I got. Sorry about that, Kevin. I do have a PowerPoint, but I think I finally got the song downloaded. So I would like a line dance that a college came in and some of our locals were here, and I'd like to play it before I go into my PowerPoint, if that's okay.
It'd be great.
Because I never could get it downloaded to my PowerPoint. But anyway, my name is Charlene Cook. I'm with Rural Appalachian Improvement League in Wyoming County. We do the Wyoming County Diabetes Coalition. So we don't own the rights to this song, but this is one of those upbeats, and we had a blast, the local people and the college that was with us here. Okay, so we're going to try to go ahead and get it shared, okay?
Sounds great.
Okay, if you're sharing your screen and you're sharing the audio, be sure to hit the share sound checkbox during the share.
Okay, just 1 minute.
Okay.
Is it up, Kevin?
I don't see anything shared yet.
You don't see
but
it shared.
we might be experiencing a little delay there.
Okay, get the right here. Okay, just 1 minute. Share right there.
And just make sure you hit the share sound checkbox in the share window.
Okay, we got it.
To the right, to the right.
Do you see it now, Kevin?
Now take your left hand and put it on your side. Don't roll your shoulders. Do the slip and slide. This next part's my favorite part. This time it's shine. Do the twist. That one. That sweetheart. It's been a way to hold down and get it. Take it to the left now and then pull it. Don't pull down. Like a sand. Pull it out. Lean back with the hands. Slide to the left, slide to the right. Now cool down, have a good time. Slide to the left, slide to the right. Do the butterfly, have a good time. Round, 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 round you go. It's time to show out right now. Now what? That sweetheart, it's been a bit to hold down and get it. Take it to the left now and get it. When it don't throw down, take a sip, pull it out, lean back to get session. Take it down now, take it down now, take it down, take it down now. Bring it up now, bring it up now, bring it up now, bring it up now. Take it down, crisscross. Bring it up now, cross. Do whatever you like right here.
I hope you all enjoyed that line dance. Let us figure out to get my PowerPoint up.
That was great, Charlene.
Thank you. They had a blast. You see the little girl?
Yeah, I see her mom. I don't know if that was her mom, but she was trying to figure out which was her right foot and which was her.
No. But it was a fun evening, and that child had a blast. So it shows you at any age you can line dance. You
That's
just
right,
move.
that's right.
Basically, you move with line dancing.
Mm-hmm.
Okay, let me get my PowerPoint up. No, that ain't it, is it? Right there. Can y'all see my PowerPoint?
Yep.
Mm-hmm.
I think it's gotten a little off here, I think. Okay, I'm gonna skip a couple slides. Here's several projects that we do here at Mullins Opportunity Center throughout our county. But as you can see, I've got line dancing there. That is one of the fun times as well as a good activity. Here's the group. They were students from James Madison, and they were at the line dancing class. So when we do our line dancing, not only do we reach out to our local people, when the people come in from out of state, we put them in there with us. So we encourage line dancing tremendously here. We also, we work with it. We have a weight loss program here that we work with the line dancing. It's not only good physically, it's good mentally. Our line dancing instructor had lost a daughter, and it was out of the blue. She lost her daughter, and so she needed something to occupy her mind. And this is how she went, is with line dancing. And she's been doing it since, I think, 2005. I've been with her since about 2011, I think. And we have just interjected it with various projects. We've went to the school. We've had line dancing with the students and teachers there. We've had it here at the Mock. We've done like the Dogwood Festival. I was looking up, and as you can see, the little girl was there. And the kids at school was just awesome with the line dancing, you know, to see them, just to get in there. We also had Duquesne University one day. They came in, this was in early February, or later part of February of this past year. So we were excited they got to come before COVID hit all of us, both universities, and we love getting them involved with our local people. And we have our line dancing class because it's very good exercise. You know, a lot of people look at dancing as fun, and yes, it is fun. And I was looking up a while ago, it said, if you were, say, 200 pounds in an hour, you can burn 408 calories rather with it. And I thought, man, that's really good, you know, because we line dance here at the Mock about 2 hours. And I'll talk about a person here in a minute that line dancing has really helped not only his weight loss, it's helped his heart muscle. Because with all the diseases that's going on, and he has COPD, he has heart issues, and well, let me go to that next slide. This is actually my husband, so I know firsthand what his doctors is telling him. Alan Cook, he's lost 27 pounds through line dancing. And not only has he lost it, he's maintained it for 5 years. And that's how he's maintaining. And he's doing it through line dancing. And you know, it makes you physically fit, but it also mentally, you know, when you get with several people and you're laughing and you're carrying on, it's encouraging. You know, it can keep you from depression if you're going and being that active around people. So we're excited about the line dancing here. We say we got a team because we do have some faithful ones that comes all the time regardless. Even through COVID, several of them has been, can we line dance? And we have allowed some to line dance through COVID as long as they had, you know, so which you do distancing when you're doing line dancing, and they had their mask on. So it's an awesome thing to be able to offer those. That we have a shed unwanted pounds that we've had for several years. So it's been exciting to tell, you know, hey, you need to go to the line dancing class. It will help you physically. It will help you mentally. And like my husband with his heart, he has 14 stents, defibrillator pacemaker, and he has black lung. Now, you would think he wouldn't be able to do line dancing, but this man does line dancing, and his doctor has told him, keep doing it, keep doing what you've been doing. You know, if you get tired, sit down. So that's how he, and Sheila knows him. I mean, that's how he has kept his weight off, is through the line dancing class. And that's been really exciting, you know, to see him, because, you know, with the issues physically that he has, he don't need a lot of weight on him, especially. Well, none of us really do. And, you know, when you sit and you think about losing 408 calories up to, if you're 200 pounds, and, you know, if you're heavier or even smaller, you know, the calories is going to change. But it's just such a great way to unwind, to relax. I mean, it has all the good benefits. It's an excellent way to burn fat and calories and lose weight. It can also increase your muscle strength. But I really like the mental benefits. It can help improve your mood and reduce your risk of depression. It's just such a fun activity. I know they're coming, the team is coming here tomorrow to line dance. She said, if nothing else, can we just come and sit and talk? Because she's, you know, her husband just got out of the hospital, and she's just, you know, wanting to get with her friends. So, you know, it's a great time to spend and have a lot of fun. And then we have Bobby Davis there. He's in our weight loss. He's lost 30 pounds. He continues to maintain his weight loss after 2 years. And I think that is very, very exciting that he has maintained it, because when you can maintain your weight loss, whether it be walking, watching your diet, and he does watch his diet. He's come off all like sugar and soda and that kind. He's very active. We work with our local food pantries also, and this gives us an opportunity to hand out diabetic literature. You know, we did this during the COVID times. We also hand out literature inviting people to our line dancing class. That was a good way for an outreach, because, you know, not everybody has a computer, not everybody has Facebook. So you got to figure out another way to help reach out to them. Like my mother, she would never seen on Facebook if there's something going on at the mock without me telling her. And, you know, there's a lot of people that would get involved in the different activities if they could. We also, we work with the Greenbrier Dream Tree program. So when we have a dinner at Christmas time, we couldn't this year because of COVID, but when we do, we line dance. We take this as an opportunity to promote line dancing and the exercise of it. And I mean, we have 125 whatever people that'll come to this dinner with the children and the parents to receive the gifts. So that's a good time. We take all these events to let them know, hey, what we're doing. Come to our line dancing, come to our weight loss, you know, whatever we're doing, you know, we can promote it through all of our programs, which has been awesome. We now here at Rural Appalachian Improvement League, we've been doing water trails on the Guyandotte. There's 5 we've gotten done. That's a great way of exercising, is kayaking. I sat in a kayak one day. I don't know how many of you kayak, but I sat in one day and I told one of my coworkers, I said, I don't believe I'm gonna be able to do this. It turns out I'm in trouble. But it is a good way to promote exercise, because that's not an easy, you think floating down a river is easy to do, but it's not. I had Senator Buck Stover, we did one trail and he rode it, and he flipped over, and here his kayak comes down the river ahead of him floating with these life jackets. So that's a good way, you know, form of exercise that we have promoted. So, but our line dancing, you know, I would encourage, I heard you, Kristen, talking about starting that. It's an awesome class to start, and for it has sustained itself. It's been here, I think, since 2005. Even before I got here, it was here. And our teacher, Patty Scott, has done so much with our line dancing. And anytime, we also went like to Southern Highlands. Their clients, we line danced with them. And, you know, you'd be amazed at what those folks, how much they picked up on line dancing and the exercise that it would give them. And you know, it was a happy time. Yeah, I look at it as a happy time. I love being there. There's times I'm not able to line dance, but I'll go to line dancing just to be able to sit down and talk and chit chat with our friends. So it really does, it really, really does help mentally. So this is a lot of our sponsors and people that works with us throughout the year on all of this, and we appreciate all of them. We appreciate Marshall and everything and all their help. Richard and Sheila, y'all been my go-to for the last several years, and I appreciate all that you all have done, and for Marshall supporting us here at Roy Appalachian League, that we can have these programs. Does anyone have any questions?
Yeah, and I would open up to questions for either one of our panel speakers from this afternoon. All right.
It's not a question, but it's a comment. These activities really help to improve, to discourage social isolation, which has happened during COVID. And it also has an impact on mental health, which is really important during this time.
We're also we're gonna do line dancing virtual. I'm just waiting on our instructor to when she can get back, and I've done talked to her. So I've got Heather here with me, and she's gonna be working close with me, but we're gonna do some virtual line dancing.
Well, that's great too. Yeah.
I like the exercise you guys were doing with the songs. So that was really, I thought, well, that's a good idea to use on virtual.
Yeah, it's great.
Thank you.
All right, thanks, Charlene. Charlene, I
You're
think if
welcome.
you stop sharing, then we'll be able to go back to
okay.
the grid where we can see everybody. And now we begin to come to a close for our conference. But before we do that, Regina, can I go to you and Sheila to you around the goodie bag again?
Yes. I'm just going to share one slide here. And so I just want to remind everybody that we do have a YouTube channel where we are posting our virtual office hour sessions. So if you happen to miss one right now, they've been monthly. We didn't have one last month, but we hope to get back on schedule. You can go back and see all of our previous virtual office hours where we've had a lot of good discussion. We've had presenters on there, speakers. You can go back and watch those for previous months. We also have our e-newsletter. If you haven't been getting that, in our e-newsletter, there is a contact list for all of the coalition. So it'll have the coalition coordinators and their email addresses listed in the e-newsletter. And of course, we have transitioned our General Yoga Leaders program to a virtual format. So more information will be coming out soon for how you can register for that program very soon. We will also have a virtual goodie bag that you will get via email. It will be a zip file, and all of the resources that have been shared today during our presentations will be available in that zip file, which will be your virtual goodie bag.
All right.
That's all that I had.
You know, as we begin to come to a close, I have to say this is our first, Sheila, Regina, Mary Glenn, our first virtual conference. You know, things like this don't come together without a lot of planning from this Marshall team, and boy, are they go-getters when they decide to put something together and get it done. And so it's been a pleasure to support that group and be part of that team in planning with Kevin to kind of walk us through all the IT things and keep us going here. It doesn't come together without our keynote speakers. So Eric and Pat, thank you for that. Most of all, it doesn't come together while we couldn't be together in person without all of our coalitions and all of you and the partnerships and the expertise you bring in sharing all the work you do. But as we come to a close, what I learned with my first meeting in Gatlinburg is there's always one thing that we get before we leave, and it's a chocolate chip cookie from the Dr. Crespo chocolate chip cookie tree. So I think before we leave today, we should ask Dr. Crespo if we can get a cookie from that tree, and he can help us do that. And then give him a wave and give each other a wave before we go after we get that cookie. So Dr. Crespo, I'm going to turn it over to you.
Okay, folks, you're gonna have to stand up. It's almost 1:30 in the afternoon, and it's time for coffee and a snack. So there's nothing better than chocolate chip cookies to go with coffee. So we're gonna have to do this virtually. And you're gonna have to imagine that you're standing under the chocolate chip cookie tree. The fruit is ripe right now in the spring. And so all you have to do is reach up with your right hand and reach as high as you can go. The higher you go, the tastier the cookie will be. And twist it and bring it down. And you can never eat just one chocolate chip cookie at a time. So with your left hand, reach up as high as you can go. That's it. A little bit higher there, Charlene. There you go. And twist it and bring it down. Now enjoy your no calorie chocolate chip cookies and don't make a mess.
All righty, thank you.
So thank you everybody for attending. We so appreciate your time and grateful for the opportunity to be able to come together, and we will do it again. Hopefully we'll be able to do that in person, but if not, we'll navigate our new normal. And Regina, Sheila, anything additional you want to add?
Thank you, thank you, thank you. I really have enjoyed seeing you all and hearing about everything you guys are doing. Again, wish we could have just done a lot of hugging and all of that, but COVID will be over soon enough. But virtual hugs to everybody.
I just want to interrupt and say that if you did present to us and you did not provide a PowerPoint, please do so we can include it in the virtual goodie bag that we will be sending out via email.
Who should we send it to?
Anybody?
Pat, if you send it to me or any of us.
Okay.
It'll get to me.
Okay.
Yeah.
Okay.
Anyway, thanks all again for attending, and we will see you soon.
Thank you again.
Uh-huh.
Thanks.
Thanks, everybody.
Thank you.